Good morning. Good morning. We have a quorum of members present this morning, and the New York City Board of Correction June 14th, 2022 meeting is now in session. Amanda?
Thank you. Can you hear me?
Yes.
Great. Okay, so our first order of business is to do a vote on the draft minutes from the May 10th board meeting, which the board members have received. And also, just to highlight, Julio is a little bit under the weather, but on the road to recovery. And so we're going to do more of the baton passing. You're going to hear from more members today. So I'm turning it over to Jackie.
Good morning, and thank you, Amanda and Julio. Turning to the minutes from May 10th, will a board member move for a vote to approve those meeting minutes? Bobby, do I see a second? Thank you. Thank you, Jacqueline Pitts. And does any board member have edits or comments to the minutes? Seeing and hearing none, I now call for a vote to approve the May 10th, 2022 minutes.
Move.
Approve.
Thank you. By a unanimous vote, they are approved. And now I think I turn it back to Amanda.
Thank you. So today we have a pretty packed agenda. On today's agenda, we have a board resolution concerning hybrid meetings and the open meetings law. And we have a DOC presentation on RMAS and ESH and updates from the commissioner. We have a discussion of the use of mayoral emergency executive orders and our need for more staffing data. We have a report on staff findings and concerns in the ESH units, a report on violence, and finally, a presentation by CHS about the Outposted Therapeutic Housing Unit initiative that they have begun. So it's packed. We're going to try and keep it moving along. And I have a number of updates to give today. As most of you know, we unfortunately have 3 more deaths in custody to report on during the month of May. And they were Deshaun Carter, who died on May 7th, and he was 25 years old. Mary Yehuda died on May 17th. She was 31 years old. And Emmanuel Sullivan died on May 28th. He was 20 years old. And all of these young people leave behind family and friends and were part of communities. And we know that there are people out there who are deeply affected by the loss of these folks. The BOC is actively investigating these 3 new deaths. And I personally would like to hear from you if you knew these people, if you are friends or family or community members who have information that you would like to share with us, or if you would like to speak with us. I can be reached easily by the website. There's a button you can click on that says email the executive director. And we are very sorry for your loss. And we hope we hope to have a report on those deaths soon. But we would like to hear from you if you would like to speak with us. We are also working on a report concerning the 16 deaths that occurred in 2021. And hopefully that will be forthcoming soon. So we have a few other announcements to make. We warmly welcome 2 new executive staff members to the BOC team, Jasmine Georges Yila and Che Park. Che Park is our new Deputy Executive Director for Research, and she will be rebuilding our research team pretty much from scratch. Welcome, Che. Che is an attorney and a researcher. She has a master's in public health degree from Yale and a biology degree from Smith. She has a law degree from the University of Notre Dame Law School. She has worked on the Institutional Review Board at Yale School of Medicine, Yale New Haven Hospital, Yale Cancer Center, and other affiliates. She has practiced law with the Legal Aid Society, counseling children and adolescents, which is her passion, and most recently has argued appellate matters for the Children's Law Center. As a municipal attorney, she also investigated and prosecuted misconduct cases for the NYPD. She has also been a director of research at the BOC and pioneered our reporting on both quantitative and qualitative aspects of minimum standards compliance. Jasmine Georges Yila, hi Jasmine, is our new general counsel. Jasmine has a law degree from Fordham University School of Law and a degree in political science and African American studies from Duke University. Jasmine has 15 years of experience in municipal law at various New York City agencies. For the past 4 years, she served as senior counsel at the Legal Counsel Division of the New York City Law Department. She advised the Office of the Mayor and agency heads and general counsels throughout city government regarding policy initiatives, rulemaking, local regulations, and she drafted state and local legislation. She has negotiated new laws with City Council. She brings important insights to our agency based on this recent experience. She previously served as acting general counsel at the Mayor's Office for International Affairs and deputy general counsel to NYCERS, the New York City's Employees Retirement System. Welcome, both of you. We're very glad you're here.
Welcome, welcome,
Welcome.
welcome, welcome.
Welcome.
A couple of other announcements, also on the good news front. One has to do with visits. We've heard from advocates and other interested parties that you have concerns about the visit process, and we wanted to report that we're undertaking a review of the BOC visit appeal process and the scope of our work on appeals generally, not just visit appeals. We will be reaching out to people in custody, family, legal representatives, DOC, and other stakeholders for feedback in the coming weeks. And the next announcement has to do with youth. BOC is pleased to announce that we will be forming a new BOC Youth Board. We're very excited about this. The Youth Board will be comprised of young people who have been impacted by our criminal justice system and those whose families have been impacted. For instance, children of people who are incarcerated or have been incarcerated in our city jails. More details on that will be forthcoming as we move our plans along, and we expect to begin this summer. This summer, we will also be hosting 7 Summer Youth Employment Program, SYEP, participants to work in our 2 offices. This summer, as part of the mayor's plan to increase the number of opportunities available in the SYEP program this year. And next, the board expresses condolences for several deaths of Department of Corrections staff since our last meeting last month. And the folks that I am aware of from May 10th to the present are retired Captain William Steiner, retired Officer Stacy Clement, retired Officer John Murphy, Officer Edward Roman, retired Officer Nick Pau, retired Captain Jose Hernandez, retired Captain Charles Cariello, retired Officer Frank Monti, retired Officer Mark Becker, Catherine Mary Haberman, is the mother of a food service administrator by the name of Robert Haberman, who's assigned to AMKC. Captain Tandra Bowser Williams. Retired Captain Richard Schreier. And we also, again, want to thank COBA Representative Ashaki Antoine for her participation in the board's public comment period and her consistent engagement with our staff. And moving on to some census figures, the total jail census at the beginning of June was 5,514 people. They are broken down between the facilities as follows. At AMKC, the beginning of the month, we had 2,044 people in AMKC. At Bellevue Hospital Prison Ward, we had 36 people. At EMTC, we had 685 people. At GRVC, we had 510 people. At the North Infirmary Command, we had 252 people. At OBCC, we had 152 people. At Rosie's RMSC, we had 292 people. At RNDC, we had 695 people. At VCBC, the boat, we had 676 people. And at the West facility, we had 87 people. As for COVID numbers, as of last week, the number of incarcerated patients with confirmed COVID was a total of 748. The number of tests completed while in custody cumulatively since the middle of March was 62,144. The number of deaths in custody in hospital from COVID cumulative was 4. The number of staff newly under quarantine or isolation was 0. The number of staff total with confirmed COVID cumulative over time was 610. So now we're moving on to the part of the agenda where we do presentation, public comment, and vote on our open meetings law resolution. Bear with me, this is pretty dry. I'll try and get through it at a decent pace. As many of you know, the New York State open meetings law was amended on April 9th to expand the ability of public bodies to meet using remote access technology under extraordinary circumstances, regardless of the existence of a disaster emergency declared by the governor. This amendment allows the board to use video conferencing to conduct its meetings, provided that a quorum of members are present in the same physical location where the public can attend. Beyond that quorum, which for us is 5, any non-quorum board members who cannot physically attend the meeting due to extraordinary circumstances can attend remotely. And in such instances, the public will be notified and they will also be able to attend remotely. This hybrid meeting option allows for maximum public attendance and engagement with our work while promoting diversity, flexibility, and fairness, as we have included things such as childcare responsibilities, illness, mobility issues, and other broad reasons for remote attendance. It is critical that the board membership be inclusive, and this flexibility helps us to get there. The amendment requires public bodies such as the board to adopt a resolution and establish written procedures following a public hearing, and that's what this is going to be, authorizing the adoption of hybrid meetings, explaining what the extraordinary circumstances are, and a copy of the draft resolution is available on our webpage for this meeting and has been, I think, for about a week now. Nonetheless, I am required to read the entire resolution into the record. So here goes. Resolution of the Board of Correction. Whereas on April 9th, 2022, New York Governor Hochul signed Chapter 56 of the laws of 2022 relating to the 2022 to 2023 New York State budget, which included amendments to the Public Officers Law to make permanent until July 1st of 2024 the expanded use of video conferencing by public bodies to conduct open meetings under extraordinary circumstances, regardless of declaration of emergency. Whereas the New York City Board of Correction is a public body as defined in the POL Section 102.2, whereas Section 103A2A of the POL requires the board to adopt a resolution and establish written procedures following a public hearing authorizing the use of video conferencing under extraordinary circumstances. Whereas Section 103A2 of the POL allows the board to, at its discretion, use video conferencing to conduct its meetings, provided that a minimum number of members are present to fulfill the public body's quorum requirement in the same physical locations where the public can attend hybrid meetings. Whereas, in accordance with 102A2C, members of the board shall be physically present at any such meeting unless such member is unable to physically be present at any such meeting location due to extraordinary circumstances set forth in this resolution and written procedures, including disability, illness, caregiving responsibilities, or any other significant or unexpected factor or event which precludes the member's physical attendance at such meeting. Whereas, in accordance with Section 103A2D, except in the case of executive sessions, the board shall ensure that members of the public body can be heard, seen, and identified while the meeting is being conducted. Whereas, if video conferencing is used to conduct a meeting, the public notice for the meeting shall inform the public that video conferencing will be used where the public can view and/or participate in such meeting, where required records will be available, and the physical location for the meeting where the public can attend. Whereas, if video conferencing is used to conduct a meeting, the board shall provide the opportunity for members of the public to view and participate in such a meeting remotely in real time, and shall ensure that video conferencing authorizes the same public participation or testimony as in-person participation or testimony. Whereas Section 103A2G requires that any meeting where a member attends by video conference be recorded, posted to the board's website within 5 business days, and transcribed upon request. And whereas the option to remotely participate in meetings is a convenient and crucial avenue to increase public attendance and engagement with the work of the board, allowing for a broader and diverse spectrum of participants. Whereas the adoption of this resolution promotes diversity among board members and ultimately enriches the composition of the board by allowing for maximum flexibility to attend public meetings remotely, taking into account disability, mobility challenges, caregiving responsibilities, illness, among other considerations set forth in the written procedures. Now, therefore, be it resolved that the Board of Correction authorizes its members who experience an extraordinary circumstance as described above and further defined by any rules or written procedures later adopted to attend meetings by video conference, as long as a quorum of the members attend in person at one or more locations open to the public, as long as the member can be seen, heard, and identified while the open portion of the meeting is being conducted, and as otherwise permitted under Chapter 56 of the laws of 2022. It is further and finally resolved that a copy of this resolution and the established written procedures governing member and public attendance be posted conspicuously on the board website. And now I turn it over to Jackie.
Thank you. Thank you, Amanda, for getting through all of that. And I believe we have a few folks who have signed up to provide public comment on the resolution. So I'm going to call each person's name. When you hear your name, please raise your hand using the hand icon below the participants list on your WebEx screen. If you don't see the participants list, click on the silhouette of a person on the menu at the bottom of your screen. Once you open the participants list, you should see the hand icon to raise your hand. When you raise your hand, we will unmute you and you will be able to turn on your video. You can then begin your public comment. We will let you know when it has been 3 minutes, and we will move to the next speaker. And our first speaker this morning is Chaplain Dr. Victoria A. Phillips. Do we have?
Can you see me? Can you hear me? Peace and
I-
blessings.
Yes, I can.
Peace
Good
and
morning.
blessings, everyone. Good morning. It took a minute to pop up on my screen. I'm going to keep this short and sweet. I know everyone wanted to keep this part moving. So I just want to say I'm very happy to hear about the resolution. And more importantly, you know, that's something I've advocated for over the years for so many different reasons. But just all the reasons this board has mentioned the importance of the resolution, I want to take those are the same issues that people behind the walls are still dealing with and need access to you. So I just want to put on the record briefly that the sheer value of properly funding the oversight of New York City Department of Corrections is critical in eliminating the culture of torture on Rikers and throughout the department while restructuring it for success. And more importantly, based on the needs of this oversight board, I ask that along with this resolution, each of you commit to ensuring all New Yorkers, whether a loved one, concerned citizen working behind the walls, the actual detained, and upon re-entry, regardless of disability, has the ability to inform this board on the record of any and all concerns that fall under your oversight at all times. And I'll keep it there. Y'all stay blessed. See, I kept it short. I think that's my shortest one yet. Peace and blessings, y'all.
Thank you. Thank you. And the next person on our speakers list is Kelly Grace Price.
I just wanted to speak about WebEx. It's a tool that I don't believe any other city agency uses for its virtual hearings. I believe last week I got a notification for Community Board 1 using WebEx, but WebEx sucks a lot of data from us, and there are a lot of privacy issues. And I just want to say, my phone was fully charged when I started this meeting, and I just got a notification that I was down to 10%. And Twitter and WebEx are the only applications I have open. So WebEx is sucking a lot of information out of my phone. It's a very kludgy utility, and the privacy issues are pretty awful. Please, can you consider just going to Zoom? I would really appreciate it. Also, in the open resolution, there is a line that says that the board members have to be able to be seen and heard during the entire open portion of the meeting. And as that line was being read, I noticed at least 2 board members' cameras were off. So maybe you might want to be a little bit sensitive to that issue of cameras off, especially when discussing the specific resolution. I'll turn in my written comments with links to different discussions about WebEx's privacy issues. I really hope that you'll move to a different platform. Thank you.
Thank you. Thank you very much. I don't believe we have, unless I haven't received any names, I don't believe we have any further members of the public who would like to speak on this resolution. And if that's the case, I think we're ready to move to open debate discussion among the members of the board regarding the resolution. Do board members have any comments? If not, I believe we're ready to move to a vote on the resolution. And in order to move to that vote, we need a member to move. Thank you, Dr. Cohn. Is there a second?
Second.
Thank you, Ms. Rickdrink. And now I will move to a roll call vote on the resolution. Dr. Cohn.
Yes.
Mr. Franco.
Yes.
Chair Medina,
Yes.
Ms. Pitts,
Yes.
Mr. Ramos,
Yes.
Ms. Rigtering,
Yes.
and I vote yes. By a unanimous vote, the resolution passes. Thank you.
Is the commissioner available to begin his presentation at this point?
No, DOC just messaged that he's still unavailable.
Okay, so we may need to do some shuffling around of the agenda while we wait for Commissioner Molina. Would CHS be ready to go forward with their presentation about the Outposted Therapeutic Housing Unit?
And it's Patsy Yang. Good morning. Good morning, Amanda. Yes, we're ready.
Okay, and just for clarification, are you moving the slide deck along or do you need help with that?
I'm told that we can do that. No, you can. No, you can. Sorry, I misheard. If the board could do that, that would be great. I think we sent that to you last night.
Denise, is that possible?
Yes, I have it ready.
Okay,
Great.
All right, then you can go ahead, CHS. Thank you.
Right, thank you. Good morning. My name is Patsy Yang. I'm a Senior Vice President with Health and Hospitals for Correctional Health Services. And we appreciate the opportunity to update you on the really exciting and truly pioneering project that CHS proposed and has construction is underway for placing at community acute care facility sites within health and hospitals the therapeutic units that have proven so successful in the jails. And I'm going to turn it over to folks here. Go.
Sure. Hi, this is Jeanette Mayoral. I'm the Director of Communications and Intergovernmental Affairs for CHS. So we have a few slides to run through. Next slide, please. So as Patsy mentioned, so an outposted therapeutic housing unit, also an OTH by you, is a secure clinical unit within a hospital that serves patients in custody who have serious health conditions following the jail-based therapeutic housing model. So the OTHUs will improve access to care for CHS patients who do not require inpatient admission, but would benefit from close, regular access to specialty and subspecialty care available in the hospitals. Next slide, please. So we have 3 units planned. Across the 3 units, there will be approximately 380 beds. The first unit is planned for Bellevue with a completion date of spring 2023. That's followed by Woodhull in Brooklyn in 2024. And then finally NCB, North Central Bronx in 2025. Next slide, please. So in terms of the operations of the unit, CHS will provide health care on unit and the hospital will provide specialty care on or off unit as needed. The Department of Correction will provide security and custody management, and CHS will determine the eligibility for admission to and discharge from the units according to patients' clinical needs. Next slide, please. So I'm going to turn to my colleague Ashley to discuss the design and construction status.
Hi, thank you. Ashley Smith, Chief of Staff for Correctional Health Services, and the lead for our Outposted Therapeutic Housing Unit project. So to walk you quickly through our current construction timeline, for Bellevue, we recently received approval from the New York State Commission on Correction for us to move forward with the project. So we're very excited. That is our official green light. And we are nearing design finalization, which should be happening imminently. And construction began in March of 2022. And again, looking to have those units completed in spring of 2023. For Woodhull, decanting and abatement began this month. So that was our kickoff for that site. Final designs are expected this fall. And we, again, expect that site to be complete in 2024. And finally, for NCB, we've started our schematic design, and that site is also expected to be completed in 2025. Next slide. So again, some of the benefits to our patients, again, a pioneering project, really looking to increase access to specialty care for our patients with complex clinical needs. We're improving the continuity of care between CHS and H&H providers, delivering inpatient, outpatient, and outpost-specific services. And we're really excited that it further reduces visitation barriers for families, friends, and community providers to be able to get to those sites. Next slide. And another unique aspect of this particular project is the benefits to larger system reform. We're looking to bridge the gap between care provided in the jails and the inpatient hospitalization in a more dignified and humane manner. We're reducing the demand on DOC for off-island specialty transfers and escorted transportation. It accelerates the relocation of clinically vulnerable patients from Rikers Island. It expands the footprint of normalized therapeutic settings for persons in custody, and it reduces the number of beds needed in the borough-based jails. Next slide.
Yeah, thank you, Jeanette and Ashley. Just for some of the board members who are new to the board, since we have been briefing the board over the course of the conception of this goal of this project. What we learned from the jails was that our therapeutic units are really environments where patient access to care is higher, medication adherence is higher, incidence of self-harm is lower. And what we realized also was that despite the fact that the therapeutic units in the jails exist and we continue to grow them in partnership with the department, there remain number of patients who will decline the sometimes arduous and prolonged transport to one of the hospitals within the system for what could be a very short specialty consultation. So they're basically bypassing and declining potentially life-saving care just because the logistics are just so tough and really difficult for patients, particularly if you're not feeling well or not feeling at your strongest. So these units will really be different in that they are operated by health and hospitals, CHS, not the hospital staff themselves. It's not acute care, but rather than being 9 hours away from a specialist, you're an elevator ride away at most. The environments are being designed in a very normalized and humane and dignified manner. And we really think that for patients with medical issues, as well as mental health and substance use issues, this is going to make a big difference. And we'll be able to, even in advance of the borough-based jails opening, begin to relocate and really shield some of our most vulnerable, clinically vulnerable patients from what is inevitably some of the disruptions that are going on in the jails as the movement continues to, as the population and the census changes, and as the system and the city get ready to close Rikers. So we're really excited about it and appreciate the board's excitement and support for this the entire time.
I just have a question, Patsy, and thanks for the presentation. And I've never understood exactly how admissions and discharges are going to be controlled in this situation. On Rikers Island, it's complex to get into the infirmary, to get discharged from the infirmary. It is not a simple project there. And sort of two questions, who controls admissions and discharges, and will there be any persons housed in these units who are there for the convenience of DOC rather than for medical reasons?
Thank you, Dr. Cohen. Everything that is done in the jails relative to healthcare provided to people who are in detention there does rely on the partnership of the department. I think they have a full appreciation for the mutual goal of the well-being of our patients. As it is in the jails now, if one of our patients is clinically appropriate for one of the therapeutic units, we make that request to the department to place them in one of those units, whether it's the infirmary or one of the PACE units or a diabetic unit. It does depend on, of course, the department can't need to consider security issues, but I think the clinical considerations do take priority and precedence in those cases, and will again in these cases. In terms of who gets placed there, I think that's a regular communication that we have with the department. I don't think that they place people in clinical settings lightly. I think that's a negotiation that occurs, and it is a relative rarity. And I think that the fact that these units will in fact be outposted away from the jails will make them even more therapeutic in perception and reality and operation.
Thank you.
I have a quick question. Could you just review the planned capacity for each of the units?
I'm gonna ask Ashley Smith to go over some of that, just bearing in mind that each of these sites is currently either in early pre-design, as in the case of the Bronx site, early design, as in the case of the Brooklyn site, and just finalized in Bellevue, and field conditions may dictate how many, 1 or 2 beds as it is. I will also say that this is a pioneering project, not only I think for the healthcare, the quality of and access to healthcare for people who are in detention, but regulatorily it is an aardvark. It's something new. Nobody else has done this, so we are sort of somewhere between correctional oversight, correctional regulations and health regulations, and both and neither. And so as the field conditions emerge and as construction and design evolve, issues come up and get resolved as appropriate. So I'm going to, with that caveat, big caveat, please, Ashley.
Sure. So at Bellevue, we have a little over 100 beds. For Woodhull, we're looking at about 150 beds. And at NCB, we're looking at about 120 or so beds.
Thank you.
I just first wanted to commend everyone at CHS for continuing to move this forward, especially at such a fast pace. Glad to see that these will be coming online before the borough-based jails, and this was definitely one of the most creative and innovative decisions made as a part of that process. So thank you, and really look forward to seeing the units. I did just have a question, which is, how do you anticipate these units are going to impact all of the different uses of mental health and medical type units on the island, from NIC to West Facility to CAPS units, MO units? Is this, I know these are different, but will the ability to move some people in custody to these units allow you to make changes in the way that the existing units are used, or do you anticipate anything like that?
Yeah, hi Freya, thank you for that question. It's an important one. The outposted units are not intended to supplant, they're supplementing the jail-based units. They are for a population of individuals who, for whom the frequency and regularity of access to specialty care, whether it's diagnostic or screening or treatment, most likely, will make a big difference. So it will allow us to move some of the in some ways more fragile, more vulnerable patients from the existing jail facilities, the therapeutic units, to these. It does free up some more space in the therapeutic environment, which we believe every housing area should be as therapeutic as possible within the realities of the jails. Again, it's not going to take the place of, it will supplement, it will give us more latitude in terms of opening up therapeutic environments to more people who can benefit from it, whether that's in the jails or in the acute facilities.
Felipe?
Yeah, hi Patsy. Hi everyone. Thank you and commendations for making this happen and having a plan. And I think we hear you loud and clear that construction could delay, but it's the right way to go. We're all excited. Patsy, are you thinking about anything that will be particularly focused on young adults, either on the mental health side or the medical side? Like I know it's such a critical moment in their development, particularly around acute, mental health issues. And I wonder, in your partnership with health and hospitals, are you thinking about anything that would target, adolescent and young adult services for those that you care in Rikers?
Yeah, thank you, Felipe. It's good to see you. Thank you for that question. We have not, Bellevue is the first coming online. Delighted to be, that's less than a year from now, but it is, this coming spring. And we are trying to project into the future what the population in the future will need and will look like and what their needs will be. These decisions really will be clinical decisions based on an individual patient's needs. So it really will, I'm just going to tell you, it's going to depend on who is in custody at that point in time. Certainly, we recognize that young adults are a particular and a special population, and bearing that in mind. Again, the purpose of these are primarily for people with complex clinical comorbidities, most likely, heavily medical, as well as some mental health and substance use. We haven't nailed down everybody. Sorry, no, that's the wrong term. We haven't come to conclusions yet about what the characteristics of the population will be. It really will be individual patient needs, and nobody's precluded at this point in time.
Thank you. I mean, I know that you're building your capacity, and I saw that you have now psychiatrists with specialty in adolescent psychiatry and young adults. But I think it would be great that you can further fine-tune and develop that capacity inside Rikers or outside Rikers, as that is population that everyone is struggling with. Thank you.
Thank you, Felipe. And I don't see other members with questions or comments. I think I speak for all of us in thanking you for being here today, for continuing to work on these plans. We look forward to continued updates, and we are going to move on. And I believe that the commissioner has joined us. So maybe we'll go back up to where we left off in the agenda.
Yes, and so we're turning it over to Freya.
Hi, good morning, everyone. Good morning, Commissioner. At this point in the agenda, we wanted to welcome you to provide any remarks that you have prepared and want to give, including anything related to the status and transition to the RMAS system.
There we go. Good morning, Fred. Thank you. Good morning, members of the board. First, my apologies. Was just held up in another meeting prior to coming here, but I'm happy to be meeting with you all today. A lot has happened over the last almost 6 months, and I would like to take this opportunity to reflect on where we are and what lies ahead. Last week, the Federal Monitor filed an updated action plan for the city and the department to address the decades of mismanagement that have brought us here today. I want to emphasize, as the Monitor did, that the conditions in the jails today are deep-seated and are not only the results of failures within the department. The failures of our jails represent the failure of a whole system. Accordingly, it will take a concerted effort to move us forward. The Board of Corrections partnerships will be critical to implementing this plan and other strategic initiatives as the department continues down the road towards reform and renewal, despite the real challenges that lay ahead of us. As I stated in my testimony during the department's fiscal year 23 executive budget, I am in agreement with the plan as it supports my vision for the department. I am focused on creating a culture of discipline and service to persons experiencing incarceration that will ultimately lead to safer and more humane jails. Ultimately, my vision is of a jail system that serves the public interest and has earned the public's trust. I know that is no easy task, but I believe the work we have undertaken in just 6 months is proof of concept that will serve as a foundation for the many successes ahead of us. In my first 6 months as commissioner, I have taken thoughtful and effective steps to create an agency I envision. At the end of February, just 2 months into my tenure, I instituted a strategic violence reduction plan at the Robert N. Daverin Center, RNDC, to address the heightened levels of violence at that facility. This plan took a holistic, multi-pronged approach to address the complex issues that have contributed to increases of violence and disorder within the facility. I knew that if we could get it right at RNDC, with arguably one of the most difficult populations to manage, then we could replicate success across the department. This plan implemented changes to housing policies, improvements to staff supervision and accountability, and enhanced programming and services to provide critical opportunities for behavioral change and growth for young adults. The plan ended the misguided practice of concentrating gang affiliations in housing areas at RNDC, which allowed for people in custody to overpower our staff and lead to an atmosphere of violence and fear. We have strategically increased facility searches and tactical search operations at RNDC and throughout the department, a practice that was largely abandoned during the pandemic. These searches have resulted in the recovery of over 700 contraband weapons at RNDC alone and over 2,200 across all facilities. The number of slashings and stabbings at RNDC decreased by nearly 80% in May as compared to March of this year. When we instituted this strategic violence reduction plan, it also decreased by 63% department-wide slashings and stabbings when you compare our numbers in May department-wide of this year to March of this year. In his May 17th filing, the Federal Monitor noted the effectiveness of this plan at reducing the level of fear among staff and people in custody. Because of its success, we are beginning to implement a similar and a like strategy out at other facilities, including GRVC and AMKC, with the anticipation of similar results. In just 6 months, these actions and others have resulted in a decrease of several major violence indicators. Calendar year to date, department-wide assaults on staff continue to be under 30% of where they were this time last year. Use of force has decreased 27% calendar year to date. And in May of this year versus May of last year, slashings and stabbings department-wide are down 44%. As of yesterday, month to date, June of this year versus where we were June of last year, we are currently experiencing a 21% decrease in slashings and stabbings department-wide. Now, I recognize that the frequency of assaults, use of force incidents, and slashings and stabbings are still too high, but fortunately, the trends are moving in a downward direction, which I'm intensely focused on sustaining. Of course, our facilities do not exist in a vacuum. They operate within a broader context and culture of the entire agency. Implementing best practices and sustaining positive trends cannot occur without well-trained staff to perform their duties, along with a timely and meaningful discipline process for those who do not or cannot perform those duties. Since taking office, I have been laser focused on returning staff to the facilities and creating leadership structures to support our workforce and address our deeply entrenched organizational health issues. The number of unavailable staff continues to drop and has been reduced by nearly 40% since the beginning of the staffing crisis that began in the summer of 2021. To ensure that our staff return to full duty, we are revamping our health management division, which is responsible for overseeing and supporting our uniformed staff who are out sick. New leadership has already been appointed, and we are reviewing and revising critical leave policies that have allowed abuse to fester and lead to the crisis that emerged over the course of the pandemic. I look forward to sharing these updates on these efforts with the board once they have been finalized in consultation with the monitoring team. In conjunction with efforts to engage staff who are out sick and support them in returning to duty, we have been taking a close look at those members who appear unable or unwilling to fulfill their obligation to this agency and this city. In order for the Department of Corrections to succeed, it is imperative that expectations for staff conduct are clearly communicated and that the consequences for violations and failures to fulfill duty are swift. To date, almost 100 staff members have been suspended this year for sick leave abuse, and some of those members have been referred to the Department of Investigation for further review. And there have been at least 150 medical incompetency cases that have been referred for discipline, which is almost the same number of cases referred for discipline in the entirety of 2021. We intend to expedite the processing of more egregious cases to demonstrate unequivocally that these abuses will no longer stand. I believe these initial steps have put us on a path toward improved practices and greater accountability, and I look forward to sharing more progress with the board in the future. I am confident that my vision for this agency is achievable. I knew full well the challenges that lay ahead when I accepted this position, and I have approached each new challenge with renewed commitment. Likewise, the majority of the uniformed staff have stayed in this fight and came to work during the height of the pandemic to serve the people in our custody, and to continue to do so today. In the past 6 months, several passionate and committed men and women have joined my leadership team in the fight to reform our jails, with more to follow. And members of this board have dedicated years of their life to serving this department's interests. Through all of its highs and lows, I believe in this work, and I know that the members of the board do as well. I hope that our shared commitment will drive us forward together. We must have more than shared interests. We must be allies in this work if we are to succeed in reforming the department, and we also must be prepared to pivot together when initiatives and other programs do not work out as intended. I thank you for the opportunity to speak today. My colleagues and I are available to answer your questions that you may have. I think, Freya, you had asked in the onset about where we were as far as an update on RMAS. I'm going to turn it over to Stephen Kaiser in a second. But, we've had private discussions, members of the board and myself, as to where we are with RMAS. The mayor has sort of instructed me and informed me to make sure that I do what I can to operationalize how we do our restrictive housing with the resources that we have. So it's our goal to operationalize RMAS, as was our commitment July 1, and we're spearheading towards doing that. We have appointed new leadership that's going to be overseeing the operationalizing of RMAS, Deputy Warden in Command Court. Some of you may know Deputy Warden in Command Court, but she brings a lot of years of experiences in managing restrictive housing. So I'm confident that we're going to be able to do this July 1. We're certainly going to hit some bumps in the road as we operationalize this. But I think with our commitment towards doing this and your support, we're going to make this happen on July 1. So with that, I'll turn it over to Stephen Kaiser.
Thank you, Commissioner. Good morning, Board. My name is Stephen Kaiser. I'm the Assistant Commissioner of Strategic Initiatives at the department. Happy to provide an update on some of the work since we last met. Since the last meeting, we've finished construction in 4 planned RMAS or RRU units at 9A and B, 3B, and 17B at GRVC. With regards to the training, we now have 471 staff who have completed the phase 1 training. Again, that's a full week training that includes a review of the policy, due process, procedures, and other important parts of operating in an RMAS unit. That 471 includes 416 uniform staff, 55 non-uniform staff, and in addition to that 471, we have 106 staff who have completed a partial phase 1 training and need to finish a day or two. And that 106 number includes 62 uniform staff and 44 non-uniform staff. We additionally started the rollout of the phase 2 training, which is an additional second week of training, which will be rolled out through the RMAS rollout and will continue once RMAS begins. To date, we have 32 uniform staff who have completed that training, 7 uniform staff who have completed a partial phase 2 training. As the Commissioner noted, we remain on track for a July 1st rollout. The policies which were shared with the board previously, as well as with our other oversight bodies, including the monitor, are on track for promulgation by July 1st as well. Also happy to provide an update with regards to the de-escalation units and those rollouts. We are on track for a July 1st rollout for the de-escalation as well. Since our last meeting, GRVC's de-escalation unit opened on June 7th. And we're planning to roll out the final unit at EMTC on June 27th, as well as re-implement the unit at RNDC, which was closed temporarily in April. That's the update I have. I'll turn it over to our legal division to provide an update on due process.
Good morning, Michael Ford. I'm one of the supervising attorneys in the department's legal division. The department came into compliance with the Halt Act requirements on April 1st of 2022. The department relies on enhanced supervision housing to safely house individuals who have committed acts of violence, have been found in possession of scalpels or other dangerous weapons, and individuals who have a history of serious violence and serious violent incidents in general population. We do all this to maintain the safety and security of the individuals housed in general population. The department is continuing to move forward towards our July 1st implementation of the RMAS requirements. However, we are still working out some of the operational details as it comes to due process, but we are happy to continue the conversation about those details with the board offline.
Commissioner, I'm very, very confused. Over the past 3 days, you've told us that you were not going to implement RMAS. Now you're talking as if you are. Could you please clarify that for me? We spoke personally, we spoke collectively, and you said that RMAS was not something that you were going to do anymore.
Yeah. So after our conversations, the crux of what was going to delay RMAS July 1 was really our ability to be able to meet these timelines for the due process around the new captain's hires. What I've been able to do is we're evaluating the captains that we have TDY. We've already begun to transfer, I want to say about 15 or 16 captains back to facilities, not only to help us support and stand up RMAS, but we have an opportunity. We're going to be able to backfill some of those captains with some promotions of funded lines that I already have with the department. So when we met with the team yesterday, late into the hours, I understood after speaking to you and other members of the board of the importance of RMAS is to this board. I understand the importance of being able to evolve our restrictive housing model so that we give people an opportunity to be safe, but hopefully also give them an opportunity to reflect on what they've done so that they can make it back within GP within that time period. Given all of those importances, the team and I huddled together, and we're gonna give it a go to operationalize RMAS July 1.
Okay. Glad to hear that.
I apologize. I may have missed something because we had a fire alarm in my building for a few minutes. But did you speak to what is going to be if you're going to need any variances or any sort of exceptions for certain elements of RMAS July 1? And is there a timeline for implementing it in full, or you'll be able to begin in full on July 1?
To the legal.
We will be maintaining the current EEOs in the meantime to ensure that the RMAS program will be covered in case of any issues. We will, however, be dropping the current EEO with relation to de-escalation on July 1st. We'll continue to work with the board to make sure that this plan gets implemented and operationalized.
And what about the representation element of RMAS?
I can say that we have a meeting scheduled with the defender organizations for this Friday to discuss continual operational strategies.
Do you anticipate at least on the DOC side and what is within your control, the ability to operationalize that by the 1st, or is it something you anticipate needing more time for?
We are working through the operational details of that, and we will provide you an update on that offline.
Will you be requesting any variances from the board regarding RMAS? Next week, the week after, the week after that, the week after that? You've refused today to use the variance system, and I hear that you're going to continue the EEO system. How are you going to work collegially with the board in this manner?
Thank you, Bobby. I think all of that will flush itself out as we operationalize it. And I think together we will see that there might be some obstacles where we might need more time. And at that time, we will explore that opportunity about the variances. But for right now, I need some level of flexibility so that we're not out of compliance, and the EEOs provide that.
Could you explain to me what flexibility you get out of this? You could ask for a variance and we would or not give it, or would or not give it to you. But if we gave it to you, you'd have flexibility. Why does eliminating the board management tools that you have, the rules of the board, give you flexibility?
Because I don't know what I don't know at this moment, right? So we're having a meeting with the Defender Service to make sure that they're operationally ready to be able to represent their clients through these infraction hearings. I'd like them to be part of the conversation with us as they're our strategic partner in making sure that RMAS is successful. We will update the board as well offline, and we may get to a point where we sort of have an agreement on what sort of nuanced variances we might need in order to sort of make sure that we're going towards the same goal.
The EEO problem is next on the agenda, but before we move to that, I wanted to make sure that there aren't other member comments or questions in response to Melina's presentation. I think that Ms. Pitts may have some things she wanted to add.
Yes, good morning, Commissioner Molina, DOC staff, CHF, S staff, fellow board members and stakeholders. It's clear to everyone that RMAS and ESH is prominent, and it's something that the department is working on. But in addition to that, there are other areas in the department that require attention and resolution. As some of you know, the North Infirmary Command houses physically vulnerable people, many of whom are wheelchair bound. In May, the Board of Correction inspected Dorm 1 in the North Infirmary Command and noted the following conditions in the bathroom. There was an overall lack of cleanliness. Surfaces were covered with grime, rust, and mildew. Large pieces of paint and plaster continuously fell from the ceiling. There were missing floor tiles and uneven floor tiles in the large and small shower areas. And these areas are used to accommodate wheelchair-bound detainees. As a result of those conditions, several inmates had sustained injuries and were sent to the hospital. I toured the area on June 10th and saw the area was closed. It was clean, the ceilings had been scraped and painted. The large and small shower area, floor, and walls were resurfaced and retiled. It appears all the work was completed. My question is there more work to be done in that area, and when will the unit reopen for housing?
Thank you, board member, for your question. We always appreciate the board for bringing this issue to our attention. And when the board did that, we took immediate action to abate these conditions. Individuals, as you stated, were immediately rehoused, and our facility maintenance and repair division brought the unit back up to standard. The walls, as you have described, have been scraped and painted. The floors have been stripped and re-waxed, and the bathroom was completely renovated. All bathroom flooring was replaced. Showers have been totally renovated, and brand new walls and flooring have been installed. We will continue to closely monitor conditions in all of our facilities to ensure that this is an isolated incident. As to when detainees may repopulate that housing unit, is it still closed? Chief, it's open. It's been reopened already, so detainees have been placed back in that housing unit already. Thank you.
Thank you. Thank you.
Felipe?
Hi, Commissioner, and thank you for your commitment to get something done by July 1st. You mentioned the meeting with the attorneys as one of the prerequisites to move forward your plan. But in my most recent visits with other board members, it seems that one of your biggest challenges is making sure that people have out of cell time. In our visits, in most units, if people are lucky, they get 1 hour out, but they're definitely not getting the other 7 hours that should be out of their cell. In a few of those visits, sites that I went last week. Are you going to be ready by July 1st to make sure that people can be out of their cell and be locked out as intended, 7 hours?
Thank you, Member Franco, for your question. Yes, we're going to be ready, and we're going to be putting checks and balances in place to make sure that that out of cell time opportunity is accountable. Deputy Warden in Command Court, it will be overseeing restrictive housing. So we've chained up management as it relates to currently ESH today, what will be RMAS after July 1. Deputy Warden in Command Court will report directly to me on restrictive housing to make sure that I'm aware on a day-to-day basis what's going on there. In addition to revising our log entries to make sure individuals are afforded their out-of-cell time. We also will be putting on body-worn camera footage every time that's afforded to detainees. And of course, to ensure that there's checks and balances. If the board wanted to spot check that footage to just for fidelity, I would have no objections to that.
Thank you.
I do think the problem, Commissioner, is not the fact that you're not documenting the fact that people are not getting out of their cells. The problem is that they're not getting out of their cells for 23 hours a day.
We will create an environment with programming that encourages individuals to come out of their cells. The census TC in level 1 is going to be 12 to afford the members in that community to feel safe to come out. But as you know, the RMAS rules do not obligate anyone to participate in any programming or any congregate interaction. So all we can do is hope that our program staff, as well as our steady uniform staff that's engaging with the population, get them to a point to feel psychologically safe and physically safe to be able to congregate with one another.
Is there any other, Felipe?
Commissioner, you began talking about programming. Can you give us a sense of your plans for the summer, particularly with young adults and school, work, programming?
So I can share with you today, I'm missing it right now because we have our meeting today. I'm sure many of you would have liked to have attended, but today was our East River Academy graduation. We have 21 students graduating. I believe the mayor is on his way to congratulate the graduates, their family members and loved ones that are participating them, witnessing them this big triumph. But in addition to that, we continue to work with our contract providers. We have made some steps in getting more faith-based leaders to be involved with our young adult population. So that's underway over the summer. And we continue to work with our partners at the Department of Education to provide career technical education, vocational opportunities for the young men that are in our care.
What about summer youth employment? I know that young people who are in detention facilities or who are in probation are being taken advantage of those programs. Will young people in Rikers be able to work?
Good morning, board member Felipe Franco and the rest of the board. We're presently working internally to identify job placements for some of our young adult population. It is an initiative being driven by Assistant Chief Lemon as well as other areas within our department. We will certainly be more than happy to share with you what it is that we are planning as well as when we roll it out. Thank you.
Thank you.
Freya?
I just had one question. I wanted to go back to the top of your remarks, Commissioner. You had talked about the improvement plans at RNDC and the successes that you've seen so far with injury rates or violence related to people in custody. I'm wondering if you've also seen an impact with the staff and have seen any more consistency or fewer absences or AWOLs or anything along those lines with staff feeling presumably more safe and comfortable in that environment.
Thank you for the question, Freya. So I could tell you when I visited RNDC, I think when we got comments from the federal monitoring team that has done visits, there is just an enhanced sense of safety within the RNDC, not only for those that are detained, but for those that are working there. So we provided a good level of support for our staff. I'd like to give a lot of credit to our credible messengers that are interacting with the detainees as well, and have also built a rapport with our staff at RNDC. We're starting to see a lot of staff coming back to work. In general, I don't know what the exact numbers are at RNDC, but the facility is in a much better place today than it was, what I would say, back in March.
Are there any other questions from members? Should we move on in the agenda? Okay. So we're now at item 5 on the agenda, where we discuss the use of emergency executive orders that was mentioned earlier in the meeting. We want to refocus some thinking on our minimum standards, what they are, why they're important. So, hopefully everyone who's attending this meeting and has been following the work of the board is already very familiar with our minimum standards and what they are. But worth repeating and explaining for anyone who may not be or may not be focused on them right now. The Board of Correction has a very broad mandate set forth under the New York City Charter. The city charter is like the Constitution for the city of New York, essentially. It's a foundational legal document that creates the Board of Correction, and sets forth that the board has the duty to evaluate departmental performance, as well as promulgate regulations governing the care, custody, correction, treatment, supervision, and discipline of all people held in our city jails. These minimum standards that have to do with care, custody, correction, treatment, supervision, and discipline of all people in custody, the minimum standards set the baseline, the very basic baseline for what must be provided to people in our jails who are held in the custody of our system. And this baseline must be met in order for our jail system to become humane. The minimum standards are found in Title 40 of the Rules of the City of New York. They are regulations promulgated according to state law, according to CAPA, or according to the City Administrative Procedure Act. We follow the CAPA process when we promulgate our regulations. The RMAS regulations, for instance, went through a 3-year vigorous process of rulemaking that involved all stakeholders, City Hall, the department, health, and was very active for 3 years. I know because I worked on it at my former perch at the law department. A lot of work goes into creating the minimum standards. A lot of input goes into creating the minimum standards. And once promulgated, the minimum standards regulations have the force of law. The manner in which the department operates to provide care, custody, correction, treatment, supervision, and discipline of people in custody is controlled by laws. The board is the city's regulatory oversight of the Department of Correction. Our staff work inside the jails every day trying to problem solve conditions and the violations of the conditions, the violations of those baseline minimum standards as soon as they can in the jails, as soon as possible, to prevent harm to everyone in the jails. The minimum standards, when they are followed, safeguard the health and the welfare of everyone who lives and who works in the jails. The minimum standards do not hinder crisis resolution. Rather, they are the basis for preventing crisis escalation. Our staff work very hard every day in the jails with department staff and correctional health staff and program staff and people in custody and everyone who's in that community to enforce the minimum standards, problem solve when the problems are smaller so that they don't get bigger. When our minimum standards are followed, they help make everyone more safe and they help make the jail humane. Since last fall, mayoral emergency executive orders, the EEOs, have been issued and renewed to suspend some of our minimum standards based on the DOC crisis in management of DOC staff. At every meeting, we explain what emergency executive orders are still in place that affect the board's ability to enforce minimum standards. So yet again, I'm going to go through them. The following are mayoral EEOs that have so far affected our BOC regulations. The local state of emergency due to officers not attending work is renewed every 30 days. And that local state of emergency forms the basis for each of these EEOs, which are renewed by the mayor every 5 days. So every 5 days, there's an assessment that these must continue and they're renewed. And they are as follows. EEO 241 was initially issued on September 15th of 2021. It declared the state of emergency within correctional facilities operated by DOC due to excessive staff absenteeism and staff shortage. It suspended BOC minimum standards relating to the commingling of inmate populations to permit DOC to house young adults differently and commingle them. It suspended BOC minimum standards related to ESH, the enhanced supervision housing, only so far as to permit DOC to place young adults into the ESH housing units. So ESH rules were suspended, but only so that the young adults, which rules would have forbidden to go into ESH, can now go into ESH. And then solely respecting housing area 2B of GRVC, various minimum standards were suspended to permit BOC to use that for special safety and security purposes. EEO 279 was then issued on November 1st of 2021. 279 It's very significant in that it suspended some core minimum standards, such as the involuntary lock-in standard, the standard that requires that people are allowed to lock out of their cells. It also suspended the minimum standards that allow inmates to have access to law library. These are people in custody who have not yet been convicted of any crime. They're awaiting their day in court. And our rules, our regulations are such that they have access to law library. Those have been suspended since November 1st. It also suspended BOC minimum standards relating to the RMAS system. Not all of them, but many of them. Pre-hearing detention, case management upon placement in restrictive housing, due process, procedural justice, and certain restrictions on the use of restraints. Then came EEO 297, issued on November 23rd of 2021. This was issued to clear up some confusion that had been created by 279 suspending our RMAS standards. 297 makes clear that during this period of time that the RMAS standards are suspended, the repeal of ESH and punitive segregation regulations from 2015 is upended. They are no longer repealed. They will be repealed when we have RMAS in place. But for now, since RMAS is suspended, the ESH rules and the punitive seg rules are reinstated as of November 23rd, 2021. It did, however, clarify that DOC could continue placing young adults in ESH. So the ESH standards are in effect, but for the fact that young adults can be placed in ESH. Then came EEO 7. It was issued on January 9th, 2022, and suspended the minimum standard relating to the creation of De-Escalation Units, which, as was stated earlier in the meeting, apparently the department is willing to cease seeking the renewal every 5 days of EEO 7. Then came EEO 66. EEO 66 was issued on March 29th, 2022. It moved the housing area 2B at GRVC to the North Infirmary Command. And also in doing so, it let go of the suspension of the lockout standard so that the inmates in what was 2B GRVC, now in NYC, are supposed to be allowed to be locked out of their cells. In short, many of our minimum standards have been temporarily suspended due to the department's staffing crisis. From the beginning of this practice, the board has objected to the use of EEOs, and a letter from our former chair, Jennifer Jones Austin, which is still available on our website, explains why the EEOs are a threat to the independence of the regulatory authority of the Board of Correction. Now that I've gone through that, I am going to hand it off to Freya again for further discussion about the staffing crisis issues.
Thank you, Amanda. So briefly, we wanted to raise the fact that the board is still not receiving a critical set of staffing information that we have been requesting for quite some time. Specifically, we have been requesting since February facility level information. So not just summary numbers across the department and aggregate numbers at the facility level, but specifically on a regular cadence to see by facility how many people are assigned there, how many people are coming to work each day and how many people are not coming to work each day for various reasons. Additionally, what triples each facility is seeing and what unstaffed posts each facility is seeing. The reason being that at the end of the day, it's about how well each facility can function and how well each unit on each facility can function and if the minimum staffing is being achieved. So a department-wide information that might show an improving picture could be true for the department overall. And what we don't know is whether certain facilities are particularly impacted by what's going on. And so without the data, it's hard for us to assess what the day-to-day impact is and also where there may be ability to make changes in order to ensure that those staffing levels are achieved. If any other members have any other comments on staffing, or if the department wants to respond, we do continue to seek the facility level data, and we trust it's information that you need in order to ensure that the facilities are staffed as well as possible. So we would continue to request that we receive it.
No, your request is noted, and I think, you currently do get the UF 53 report. The board does currently get all the staffing data that we also provide to the federal monitor. We are looking at technology solutions that can provide us the ability to know whether it's from scanning capability of knowing when staff arrive on post and what staff member is on post, as well as moving away from a paper-based system of scheduling to a more automated technological version of scheduling. And I think once we have those technological solutions in place, it'll be easier to transmit the information that you're requesting.
Commissioner, I don't think that's adequate. I hope that you know what posts aren't staffed in each of your facilities for each tour. We've asked for that information too. These are not a technical issue. When positions are unstaffed, people are injured horribly because there is nobody to protect them. And we'll review some of those injuries later in this meeting. But it is not a technological issue. You have to know to run the jails what posts are covered, and that's what we're asking. And I wish you would provide it to us. The reason this is linked to EEOCs is because you claim every 5 days that there is a staffing emergency, and you have to renew the limitations on the board's function. So we would like to know why you are claiming that staffing emergency and understand when you will not claim it based upon the data that you're not giving us at this time.
Yeah, just to follow what Bobby just said, I think we know this is information that must be used to manage daily staffing and assignments at facilities, and that the department would want to know, and we believe does know, that which units were unstaffed. So if that information is available to the department now without the technology solutions, that also sound like a good idea to implement. But the information, we presume, is something you're looking at every day in order to know how each unit, how each facility is faring. Then that's information we are just simply asking for a copy of as well. I'll also note if members have any questions about the EEOs and all of the background that Amanda provided earlier, please feel free to also ask. Okay, seeing none, I think now we will turn it over to Jackie, who's going to be talking about ESH and the minimum standards compliance.
Thank you. I will sort of circle back to some of the questions that were raised, and Commissioner, I appreciate what you've already said about the plans for implementation of RMAS in this context. I am going to report out on monitoring by the BOC staff and visits by multiple board members over the past several weeks, including myself. And I do want to thank the board staff for their diligent work in monitoring the circumstances throughout the jails, and in this context in particular in GRVC, in the ESH units, for every day being in the facilities, speaking with staff and speaking with people in custody to ensure that we have an understanding of what is happening operationally in the jails. Based on the board's monitoring, the ESH units are not in compliance with BOC minimum standards for enhanced supervision housing. Of utmost concern, as a few members have pointed out, it appears that people in custody are routinely locked in ESH units for 23 hours at a time. ESH was designed to separate from the general population those persons who pose the greatest threats to the safety and security of others. It additionally seeks to promote the rehabilitation of persons in ESH by incentivizing good behavior and providing necessary programs and therapeutic resources. The first ESH unit was opened in February of 2015 at OBCC. Since that time, ESH has been moved to GRVC and reopened and has been operationalized in a very different manner. The New York State HALT Act, which was referenced earlier in the meeting and went into effect on April 1st, 2022, was intended to end the use of 23-hour lock-in at DOC's housing units categorized as punitive segregation and the restorative housing unit. A punitive segregation unit for people with mental health needs. On April 1st, 2022, the department issued a teletype about operational changes related to the HALT Act, which stated that units used for punitive segregation and the RHU would be converted into ESH. On paper, the conversion happened immediately for compliance with the HALT Act when it took effect. The board's monitoring has revealed that units have not been operating consistent with the rules governing ESH. Some people in custody who had been in punitive segregation or the RHU on March 31st, 2022, found themselves in ESH on April 1st, 2022, and did not understand why they were there. Others who had previously been in ESH knew what they were entitled to in terms of lockout and programming and advancement based on the ESH standards. Both groups were confused and frustrated with the way events have unfolded. On June 2nd, 2022, after a collaborative effort between board staff, the board, and Commissioner Molina, ESH Level 2 housing for young adults in 4B, a highly restrictive unit of ESH, which was routinely poorly maintained and where some young people with mental health needs were held, was closed and the young adults were moved to RNDC. The board commended the department on that move, and the board remains deeply concerned that remaining units of ESH are experiencing conditions that violate BOC minimum standards and the HALT Act. People in custody are routinely denied lockout time, and other than recreation and a shower, they are isolated for long periods of time. Before turning to the commissioner with some questions, do any of my colleagues have anything further that they would like to add regarding ESH?
I just want to confirm, I visited the week before your last visit, and people were being locked in 23 hours a day. There was no programming. There was only one area where potentially people could have programs, which was a room in which that DOC had set up that allowed for 3-point restraints, and that was used for 3-point restraints, but it wasn't even used. And there was no one was getting out of their cells except for recreation and showers. Just to confirm.
Thank you.
I would like to follow up with commending the department for moving the young people out of 4B that we had a chance to visit and talk to. The conditions were completely inhuman and awful, and I'm sure it's not the only place like that. So I'm hoping we all keep on finding them and doing what is right. Thank you, Commissioner.
Thank you. If there are no further comments from board members, I will now call on Commissioner Molina to speak to current ESH operations and further detail plans to improve it.
Thank you. After touring ESH areas a couple of weeks ago and seeing the deplorable conditions of some of the units, as Member Franco has pointed out, I immediately moved the young adults out of ESH and into RNDC to general population. So far, these young men haven't had any major incidents. I attribute this to the holistic violence reduction work that we've undertaken at RNDC. As I stated earlier, since the violence reduction plan went into effect, slashings and stabbings are down nearly 80% in May versus March. Use of force has also been down every month since March, and assaults and staff are also down at RNDC. We still have work ahead of us, but I find these trends to be extremely encouraging, and I fully believe we can replicate the success of what we've seen at RNDC department-wide. We have begun to roll out similar strategies at GRBC, and I look forward to updating the board as they take similar effect. Thanks to the success that we've seen at RNDC, we will no longer be utilizing ESH for young adults. With rebalanced housing, enhanced programming, and improved supervision, I believe we are capable of managing our young adult population without the need for this level of restrictive housing. As I've stated earlier, new leadership has been appointed to oversee ESH, and Deputy Warden Court will also be shepherding us through this period of transition to RMAS. I'm confident that Deputy Warden Court can get the department where it needs to be. She'll be reporting directly to me, and she has my full support on this endeavor to make whatever changes are needed in order to transition us to RMAS. We have depopulated all ESH levels 2 units so that we can do a hard reset under her new leadership, and ensure that good practices are upheld moving forward as we go into RMAS implementation.
Thank you, Commissioner. And we do look forward to continuing to work with you on learning of your plans and for implementation. And I want to come back to the current ESH level 1 units and ask what the current census in those units are and how many hours people in those units are having lockout.
Our total census in level 1 ESH is 48 as of this morning.
And as to lockout?
They're afforded the opportunity of lockout. They're afforded the opportunity of lockout. I don't know off the top of my head right now which one of those members took advantage of that opportunity.
And I believe I heard you say earlier in the meeting that you're planning on the implementation of RMAS includes the use of body-worn cameras to document refusals. Did I hear that correctly?
Yes.
And I think that's wonderful. That is something that we have been asking about and appreciate that. And I suppose I would say, with respect to the current census, on June 14th and through the rest of the month of June, in those ESH level 1 units, it could afford an opportunity to pilot the use of those body-worn cameras to, if folks are refusing lockout time that is being afforded to them, to work on documenting that through the use of body-worn cameras. If not, if that's not possible, I would ask that the board receive ongoing documentation of those refusals.
No, I agree with you. A teletype was sent out regarding the use of body-worn cameras. In addition to that, I spoke directly with Deputy Warden Court about that issue, and she's memorializing those instructions with her team.
Thank you. Are there other questions from other members?
Rhea?
Yeah. So in addition to documenting the refusals in different ways, I think it's also been mentioned that it's not just, there may be reasons that a person may be refusing, which may be related to security or their conditions or concerns with being locked out. Is there, in addition to what's put in a logbook, is there like a report that the department's generating every day to see how many hours people in custody and ESH are actually locking out, even if it's due to a documented refusal? Because even if everything is documented and you still find people aren't being locked out, that may speak to other conditions that are creating an environment where someone is not comfortable locking out, which could have its own negative consequences.
Yeah, so currently, right now, we only have the logbook that indicates someone was afforded the opportunity to log out. They are engaging with program providers, so they may communicate with program providers some concerns, and we can address those issues on a case-by-case basis. But we can't force people to lock out if they don't want to.
But in order to know if people are locking out, you'd have to go to the logbook and actually go through and see. There isn't a way to kind of roll it all up into some sort of a mechanism where you can actually have eyes on, how many people are locking out for how long, to know if the unit is really functioning as it's intended to.
Well, that was why it was so important for me to place new management overseeing ESH and restrictive housing and Deputy Warden Court. She reports directly to me. She will be selecting assistant deputy wardens that will be assisting her in that endeavor, as well as the captains and officers. So if we have a robust system in place of accountability throughout all of our rank structure, we should be able to get a sense of, in addition to our program providers, but maybe providing us some insight as they engage with the population as to why somebody may not be locking out. In addition to our interdisciplinary review committee, which is going to be very programmatically heavy as far as its members. And I'm sure if there is indication of non-lockout, that will be the subject of discussion with not only the chair of that committee, which is the Associate Commissioner of Programs, the vice chair, who's the Assistant Commissioner of Programs, and the prospective program counselors, and as well as program managers, to include the steady officers that are on the floor.
At the present time, there is no programming. There are no program staff. There are some some of your staff, social work, who talk to people through the bars, through the space on the side of their cell doors. So when do you think programming will begin, and where will it be held?
Right. It's going to be held in the day room congregate area. That's where it's going to be held. And right now they're doing cell side programming with these individuals.
Okay. So it's going to be 1-on-1 or 6-on-1, or for the programming? They're about 3 or 4 or 5, depending upon configuration of seats in that area.
I think that it will be a combination of those things. Some may need one-on-one intervention. As people get used to being around each other, then they'll be in a group setting to do some of that programming. But as you know, none of this programming is obligatory by any of the detainees. So we can only engage with them and hope that they will participate in it.
On that note, Commissioner, I mean, in the most recent visits, is there something that we heard loud and clear from the inmates? Was there need for human connection? So, I mean, it's hard for me to believe that they're not going to take advantage of programs. All the units that we visit are struggling with phone access, particularly. I mean, some of them, the phones are not even available. They have to get phones with a cord through the cell. And then there seems to be a lot of confusion about when they can have family contacts. So I think anything that you could do to increase EHS human connectedness, I think would be helpful to you and to the inmates.
Thank you for that, Member Franco.
Commissioner Molina, I had one question. Jasmine and I went to visit that day room area that you're speaking of recently, and I noticed that there are restraints at each seating area and separators, dividers between each seating area in that rather small room. Is the person in custody given a choice about whether they're going to interact in the day room with or without restraints, or is it a default that they will be restrained and spaced apart? How does that work?
So with the lower TC, it affords us the opportunity to not have to use restraint tests moving forward. So I don't see that as being an issue moving forward.
I just pointed out, I don't know if you've seen the room lately, but it's rather small. It's not like a traditional day room with the picnic table set up. It's most of the space is occupied by the little restraint areas that face each other. So I'm having trouble picturing what the programming and interaction looks like there.
So the day room area, as we go into RMAS, is going to be used for group engagement, and those rooms are going to be used for one-on-one engagement, neither of which we would use the restraint desk in that program engagement.
Okay.
Are there any other questions about the ESH portion of the agenda, or should we move on to the next item?
I do have one further question, which is going back to reviews on what are people who are currently in ESH level 1, the 48 people mentioned earlier, are they receiving reviews, and on what schedule are they receiving those reviews? And I'm interested in knowing what the movement out of those units is.
So as you can see from our census, there's been some significant movement out of ESH. And we will be doing reviews moving forward every 7 days, and we'll be providing those reviews to the board.
Thank you.
Should we move on to the next item then? The next item on the agenda is violence indicators, and as the commissioner knows, we've raised some concerns about what's happening at EMTC, and I am turning this part of the agenda over to Freya.
Thanks, Amanda. So I'll be going through a number of concerns that board staff, members, and others have raised related to conditions and violence in EMTC. These have been raised and discussed with the department as well. I think they'll generally paint a picture that EMTC, the intake facility, is currently a place that does present a danger to people who are in custody and to staff, and which we are deeply concerned about. Starting with insufficient staffing levels, it appears to us that it does not have the staff needed to properly run as the department's only intake facility. One reason being, before the pandemic, the population didn't require escorts, and today it does need escorts to bring people to medical, mental health appointments, programs, services. And so not having the staffing levels really impacts the department's ability to provide all of these different services. Additionally, in recent months, the census at EMTC has increased by about 22% since March. On a related issue, it's the unstaffed posts. Board staff have observed on several occasions going into housing units at EMTC and found them to be without a B post officer, so an officer on the floor. And it's worth noting that most of the units are dorm units that have pretty significant capacities of 40 to 45 people. In these conditions in May, there were 3 separate incidents in unstaffed housing units, which did lead to serious injuries. In which instances the people in custody needed to actually be seen at the hospital. Continuing on to lack of mandated and other services, people in custody in the new admission housing areas are there for longer than the new admission period of 10 days. And as a result, the department has encountered challenges providing mandated services such as law library, religious services, recreation, visits. Additionally, compounding the impact of the increased census at EMTC is the fact that the intake space is too small. The current intake space needs to provide a number of different functions. People in new admission population tend to have several court dates, the beginning of their time in DOC, and not having the space really impacts the department's ability to process courts, discharges, new admissions, and all of that happening at the same time in a constrained space. The impact of all of this is that we are seeing a really alarming level of violent incidents in EMTC in the midst of these conditions. In the first few months of 2022, there were 113 serious injuries to people in custody. The average rate of slashings and stabbings was higher in EMTC than the department-wide rate in 2022 so far. And use of forces every single month so far in 2022 have been higher at EMTC than in the department overall. I'll turn it now over to some board members who I know do want to share some firsthand observations that really underscore the findings that the board staff and others have raised about these persistent conditions and concerns in EMTC.
Thank you, Freya. I visited with Jasmine, our new general counsel, and Bart Bailey, EMTC, last Friday, and it's hard to say this because I've been to a lot of jails and many visits, but it was really frightening. EMTC, the admission area, the intake, facility, the receiving room was packed with screaming people, more than 100 people. Some had been there for many days. It was usually when one goes to a housing area, people ask you for help, and occasionally you can help someone. But the mass of people, the volume of people who were not getting their medicine, not getting to court, not being able to urinate in a bathroom because there was no functioning bathroom in two of the places, having to urinate on the floor, not getting clothing. The warden accompanied us there, and she was aware of it. She knew what was going on, and she asked for help. But she mainly asked for help in decompressing the institution. Freya, talked about that the institution is growing and growing and growing because people are finishing their intake quarantine and they're not being discharged to other facilities. And I do not think that EMTC is getting the staff needed to support that. As was noted, we didn't see B officers present, and I just 3 people. We have it. The commissioner and his staff have seen this. 3 people in different days in May in EMTC were beaten up in a mass beat up and required hospitalization. 3 different cases, and that's because there's no officer staff there. I mean, additionally, people are not being scanned. This is the intake facility for the New York City Department of Correction, except for women, and then a few other people. But everybody comes in through EMTC, and people are not being scanned. There were only 40 scans done in May. There are approximately 45 people a day, 1,200 people a month. Only 40 scans were performed, and the warden said that that was because there was not sufficient trained staff. The unit was closed down when we were there, and in June it continues. Only 7 body scans were done in the first 12 days of June. That's 45 times 12, 500 people, 12 scans. Again, in the pens, people can't get to court. They can't get to medication. Many people said they were there for multiple days. This is the post-arraignment period, and they are likely to have to go back to court in the next day or two. And there's so much chaos there that they can't get back to court. The pens were filthy, and also they were unable to call their loved ones. The use of force, as Freya mentioned, is increasing dramatically. I've never seen something as chaotic as this in the department. It reminds me of when when they were, terrible housing areas in GRBC, for Maui, but this was much worse because there were 100 plus people crowded into pens without basic services, filthy pens without capacity to urinate in a urinal. So I hope that you can support the warden and take people out of there, but I don't know how the flexibility of having an EEO helps you run that program. I don't know how the flexibility of an EEO facilitates scanning of the people. You're trying to prevent drugs coming into the facility, but you do and weapons, but you're doing nothing. You're doing very little about it. You have a great tool, and it's not being used. So I'm gonna stop there. It was very upsetting to all of us to see this, and I'll be back soon. I know that the situation yesterday was the same as it was on Friday. I'd like to know if you have any plans. You're certainly the commissioner and your staff are aware of this situation. What do you have any plans to fix it?
Thank you for your comments. At this time, EMTC is the facility best suited to process new admissions. The CDC continues to recommend that correctional facilities maintain an isolation and quarantine procedures and remain nimble in case that new variants emerge and more precautions are needed to be enacted. We recognize that we're still not where we want to be when it comes to staffing levels. I've said that repeatedly. We continue to address staffing issues in real time through our EOC and the redeploying of staff. In addition, we are reducing TDYs and reevaluating staff who are not working on posts that do not interact with people that are in custody. Per the Nunez Action Plan, we are also revising our leave policies to reduce opportunities for abuse and increase accountability when abuse is encountered. Of course, none of these are quick fixes, but we are making improvements. The number of staff out sick has been reduced by 40% since the height of the staffing crisis in August 2021, and we continue to see declines. We've just recently graduated a new class of recruits, so they've been just assigned to facilities. As we move forward with the Nunez Action Plan and other strategic reforms, and as any new guidance emerges from CDC, we'll evaluate the department-wide operations, including the intake process. You mentioned that use of force is up. Yes, calendar year to date, specifically at EMTC, it's up about 6%. But I will tell you that in March of this year, compared to March of last year, it was down 29%. In April of this year, compared to April of last year, it was down 44%. We did see big spikes in May, but at the time in March and April, we were contending with high rates of slashing and stabbings at 3 of our top facilities, and we had to divert SRT resources and staffing resources to those facilities, especially our young adult facility, in order to stop the flow of slashing and stabbings that were happening department-wide. But we will continue to reevaluate. We have sent additional staff to EMTC to sort of help and assist Acting Warden Harvey, who has been doing as best jobs he could with the limited resources that we have, and we'll continue to support her.
Of course, it makes sense that you would want to follow the CDC guidelines and therefore limit the intake spaces and ensure that you have space for quarantines. But wondering if you have considered whether you do have any options to kind of still continue to use those strategies, but across potentially a wider footprint. If, of course, knowing what correctional health has to say, I think would also be really important, but it does seem like it could be challenging to maintain the integrity of the quarantines and the asymptomatic exposed areas, given all of the other challenges that have been raised. And have you considered whether you have space at other facilities to perform some of these functions. I think the headcount at OBCC is pretty low. And I don't know, again, it would depend what CHS thinks, if it's workable to use two or just somehow spread it out more. But just wondering if you do have any strategies like that or other things to potentially provide relief to a system that even if really well run may just not be able to support all of the different needs right now and in a continuing pandemic environment.
So as the board knows, OBCC, we have been lowering the census at OBCC. OBCC, like EMTC, as this board is aware, is a defunded facility. None of the staff that's working out of OBCC or EMTC is funded to even be there. And we've had to take staff from other facilities in order to operate those facilities, given the false projections that were made of our detainee population by the prior administration.
You're saying it's funding that you would use it if you had funding, or are there staff to staff it?
Those facilities were defunded and shut down, and we've had to take staff from other facilities in order to reopen them, in order to deal with the population that has been increasing and does not meet the population projections that were made by the prior administration. And there have been other facilities like GMDC that were also shut down and closed. That, at the same time, losing 2,000 staff members since 2019 has created this perfect storm, which is what's going on at EMTC.
Do you know how many housing areas are not staffed by B post officers in EMTC today? And in GRVC? And in AMKC?
So our EOC gets a number of posts that need B post staffing floor officers, and we redeploy staff throughout the day to abate those issues so that those posts that are identified initially at the beginning of the tour that are unstaffed get staffed up.
You don't think it's not a problem of unstaffed posts?
It's a problem to run a jail that's not funded. And that's why we have unstaffed posts. It's a problem when you don't recruit for over 3 years to deal with your attrition, and that's why we have unstaffed posts. It's a problem when this department historically has not had an organizational health plan to support its staff, and that's why we have a staffing crisis. And all of those are a collection of problems that have brought us here today that this administration is trying to fix.
We hadn't heard that, as Freya said, you're saying that you do not have the staff to staff to provide B officers? Because it's unfunded?
And I would just follow it up to say, if all of the staff in the headcount that is funded was active and not on modified duty and coming to work, that I imagine would allow you to staff the B posts and to sufficiently staff intake one way or another. And we do understand it is your plan to, as reported to the monitor, to address all those staff and that you're hiring to replace them as they're separated.
Commissioner, I understand the difficult situation that you have run into, and I appreciate your consistent response to the board, except for the EEOs. You know, when we have brought things to your attention, you have tried to deal with them really rapidly and sometimes very effectively. Not always. ESH is still a giant problem, but you know, you committed to immediately make rounds as described by the you know, by your own policies. But you don't have people in the units. So it's, anyway, you have a very difficult situation right now. It's, if I were a judge, I would have to think twice about sending someone to EMTC. And if I were a prosecutor, I would think twice about asking for a high bail to send someone to EMTC and the other facilities. It's very dangerous right now, and I think it's too dangerous to be admitting people to. And the quickest solution would be to discharge a lot of people rapidly, so you would have enough staff to cope with your responsibilities of care, custody, and control. I know the city's committed to decarceration, but it's not happening right now.
If there are no more comments or questions, I think now in the agenda, we'll turn it back over to Jackie.
Thank you, Freya. And I believe we're ready to move to the public comment portion of the agenda. Okay, I see Amanda nodding, so I know that I'm right. I followed us in the agenda. Thank you, Commissioner and team, and CHS and team, and we will look forward to further conversation and engagement on these critical issues as we move ahead. And moving into the public comment portion of the agenda, we would like to encourage all stakeholders, friends, and family members of people in custody, of staff, advocates, and the public to contact the board with concerns for individual people in custody. Our oversight is strongest when we can all work together, and our staff are here to help and are in the jails every day. So turning to hear public comment, I have a list of speakers who signed up to speak, and I will call people's names in the order in which I have them. When you hear your name, please raise your hand using the hand icon below the participants list on your WebEx screen. If you don't see the participants list, click on the silhouette of a person on the menu at the bottom of your screen. Once you open the participants list, you should see the hand icon to raise your hand. When you raise your hand, we will unmute you and you will be able to turn on your video. You can then begin your public comment. We will let you know when it has been 3 minutes and we will move to the next speaker. In addition to speaking at this meeting, the board welcomes written comments. You can email written comments to us at boc@boc.nyc.gov or mail them to 2 Lafayette Street, the 12th floor, room 1221, New York, 10007. And I think we are ready for the first speaker.
Sorry to interrupt. The first speaker is here but won't be giving a statement. Isabel Chandler is here on behalf of Councilmember Carlina Rivera, but we can actually go to number 2 on the list, which is hopefully going to go off without a hitch, but I think it's the first time in a long time that we've tried to play a recorded voicemail from a person in custody. And Tanya Glover is going to valiantly help us try and execute that.
Thank you.
Hello, good morning all. Can everyone hear me?
Yes.
Yes.
Okay, great. So the following is a comment that we received from a person currently in custody. I'm going to hit the play button so you could all listen. Thank you.
Ladies and gentlemen, greetings and salutations. My name is Charles Bell, 141-220-0846. I'm speaking on behalf of the residents of AMKCC 95-7 Lower in regards to the hazardous conditions along with the inhumane and unjust treatment that we inmates are being subjected to. Now, as you know, there have been at least 3 deaths on Rikers Island since the beginning of 2022. The general public, by way of the news media, is being made to believe that these deaths are drug overdoses. However, in all reality, there's an emphatically untrue. In fact, there's a much more sinister and devious plot unfolding. For starters, DOC staff are extremely neglectful when it comes to the needs of inmates, especially medical needs. Even after the chain of command has been followed, inmates are forced to wait upwards of 3 weeks for proper medical attention. And then when you tell them you can't breathe, they tell you if you can talk, you can breathe. And that's just the beginning. In addition to being deprived of proper and timely medical care, we're being denied outdoor recreation, law library, barbershop, adequate hot water, and cleaning supplies. All this comes in the wake of an asbestos discovery in 8 Lower, 4/30/22. Last but not least, in addition to the chemical and psychological, there's also germicidal warfare being waged against us. Clogged toilets, mice feces, shower mildew with poor ventilation, making it impossible for fresh air to circulate. Now, with that said, I close with a question. Is this a correctional facility designed to rehabilitate or a concentration camp designed to annihilate? What does this sound like to you? Now, if you remember, due to the COVID vaccination, due to the COVID pandemic, contact visits were canceled. Now, if there's no contact visits going on, how are jails getting into the facility? Furthermore, I'm sorry, if contact visits have been canceled, how are drugs getting into the facility? Thank you. Have a nice day.
That is the end of the comment. Thank you.
Thank you very much, Ms. Glover and board staff for continuing to expand the ways in which people in custody are able to participate in our proceedings. And I assume that work will continue, and we are following up on the concerns voiced in the recording. And I'm going to turn to the next person on our list for public comment, and that is Danielle Gerard.
It looks like Danielle has left the meeting.
Thank you. I will call on Michelle Feldman. Is Michelle Feldman here?
Michelle has also left the meeting. We have Harris next.
Okay, Letitia Harris. Okay. Next on my list is.
Hi, hello.
Oh, hello. Thank you. Thank you, Ms. Harris. The floor is yours.
I'm sorry. This is my first time working with WebEx. I just wanted to briefly state in these small 3 minutes, I wish I had more time, that standing by as a correction delegate and listening to you guys, I think we all are aimed at the same goal, but we just having a hard time coming to it. And I really believe that correction officers should be more a part of this meeting that we have in a more direct way. I know we all have the opportunity of being here, but we need to also make sure, because we do have a lot of officers that support and also speak the same tone that you guys are speaking. So I'm here to basically let you guys know that, you know, with all the deficiencies going on, with all the new movement going on, officers are really on standby for new direction. And we really, really want new direction, and we're hoping to get it. With the bad management that we had in place, These are why things are still going on. And we wish to accomplish these goals that you guys want accomplished. We want that. And I speak to many officers every day, and the passion is here to be directed in a new way. And we want to help these individuals just as much, because before anybody, they speak to us. They speak to us about their cares, concerns, mental health, disabilities. So we want to also inform you guys that we want BOC to be involved more so with us as well. We want that immediate contact where we can, we can point out these individuals that's having this difficulty, and you can help us with assisting them, because that's what we all here. We all here for the same goals, and I hope that we can get them accomplished with this new leadership. And I want to thank the commissioner for also bringing that feeling back of finding new leadership and finding new ways of getting things done. Thank you. I appreciate you guys.
Thank you very much, Ms. Harris. The next individual on our list is Jeffrey Starr. Is Jeffrey Starr here? Good morning,
Can you hear me?
Mr. Starr. Yes.
Thank you. Good morning. I'm an intern with the Urban Justice Center, and the following is testimony from an individual who is currently incarcerated. I was born in Manhattan in the late 60s and grew up in a middle-class Italian neighborhood in Queens. As a kid, I was pretty articulate, a good writer, and I could draw. I was also kind of the class clown, and I had a short attention span, which turned out to be part of my learning difference. I was first incarcerated when I was 20 years old because of my drug use. Since then, I have spent more time in prison than out on the streets, and I have spent about 9 years total in solitary confinement. Conditions in prison have gotten so much worse since the late 80s. There's lots of neglect. Either they're understaffed or inexperienced. And if you can't provide the essentials, medical, housing, and food, you shouldn't incarcerate me. During the pandemic, we couldn't get blankets and soap, and there were no officers in the housing units. People are smoking K and dying because they can't get medical attention. 17 people died last year, and 3 so far this year. Sometimes people get beaten up, and then they get left in a cell and die there. Especially during COVID, DOC has been having trouble housing people in the appropriate location. My security classification is medium-high because of my alleged history. But when it was convenient for DOC, they put me in low security with 50 other men. During that time, I worked in the mess hall and was totally compliant. Then, they reclassified me and put me in the gang house. But when I contracted COVID there, they put me back into low security. After my quarantine, I went back to the gang house again, and I got jumped and beaten up there. That day, I was supposed to have a call with some advocates, but I was bleeding out of my neck and eye, and the guards didn't want the advocates to see me like that. So they told them that I had been transferred to a different facility. I was still there, though, sitting in my own filth for an hour and a half before medical saw me. The nurse cleaned me up, and then they secretly moved me to another building. The doctor didn't do a full job treating me. He didn't run any tests, and he misdiagnosed me. That's what usually happens. They just give you Tylenol and send you back to your cell. I've never been beaten up and humiliated like that before, and there were no officers there to help me. There's just not enough manpower, and they're taking manpower away from the commissary, the law library, and grievances to go on security posts. That means more security and less social services. I believe I'm close to my 3 minutes. My colleague, Izzy Silverstein, is also in attendance, who will be carrying on. Thank you.
Thank you. And Mr. Silverstein, you are next on our list. Izzy Silverstein. I think I see Izzy.
Oh, thank you. I wanted to yield the rest of my time to my colleague to finish reading the testimony.
I'm sorry, I missed that.
Jeffrey, I think Izzy Silverstein yielded their time to Jeffrey Starr to finish reading the testimony.
Thank you. Can you hear me again?
Yes.
Thank you. I'm also a mental health patient. I've been diagnosed with bipolar, anxiety, suicidal thoughts, and OCD. At my age, I don't mind asking for help. The mental health staff treat me better because I'm nice, talkative, and respectful. There are good people there, but there's not enough to go around. The problem is, you can't say that you'll help me, lead me to the border, and then not help me. That's just more depressing. One time, I had an appointment where they asked me to write down what's going on in my head. I said, sure. But then I didn't get another appointment until 6 weeks later. I was livid at that point. It felt like the pretend to care center. They should have just left me in my cell. I read a study that said that anything over 10 days in confinement is bad for the human brain. So how do you fix things when you've been in solitary for 9 years? When you're in solitary upstate, you realize that if you have a family or someone who loves you, they're hundreds of miles away. It gets to you. You feel lonely, anxious, depressed, hopeless. You hear voices. You cry, but you don't want to give up because you don't want people to see you as weak. Kindness is weakness in here. Then when you leave the box, you lose other things like phone and commissary access. So what do you want to come out for? In a sense, you want to be alone to avoid problems, but that's unrealistic. You need interaction, programming, to be with people. Time in solitary affects everyone differently. It really messes with your mental capacity. And in Rikers, you never know who you're next to. The DOC should be categorizing people more carefully by their crime, history, and mental state. You shouldn't put the lions with the sheep. But they don't care. They put you in there and sweep up the pieces later. You're just a number to them. Thank you.
Thank you for your testimony. The next person on our list is Rachel Schneiderman.
Can y'all hear me?
Yes, go ahead.
Good morning. My name is Rachel Schneiderman, and I'm a corrections specialist at New York County Defender Services, providing direct advocacy for our clients who are currently incarcerated on Rikers. I want to start by acknowledging the 6 deaths in custody that have taken place this year. In the last board meeting, we discussed how Tars Youngblood, George Pagan, and Herman Diaz lost their lives. And since then, Deshaun Carter, Mary Yehuda, and Emmanuel Sullivan died under your watch. I ask that every single board member continue to visit the jails, to do it unannounced and to go often. Secondly, I want to discuss the upcoming implementation of RMAS. The latest update from the Department of Corrections leaves many questions unanswered, and despite the fact that the biggest change that RMAS enacts is access to counsel during disciplinary hearings for incarcerated people accused of violating jail rules, defender organizations have been completely left out of the conversation and planning around RMAS implementation. We heard today that DOC staff has been briefed on policies and procedures. I imagine that all defender organizations would also like to be briefed on those policies and procedures, as we have not. And in my written testimony, you can find a list of specific questions about RMAS. And if the board wants implementation to be successful, we ask for your assistance in getting answers. Finally, I want to mention 3 of our main concerns about RMAS, which are the accurate reporting of refusals, the right to a speedy trial in disciplinary hearings, and the continuance of executive orders. To put it plainly, we do not trust the department to accurately report refusals. DOC staff have lied about video conference refusals, court refusals, visit refusals, and we have no reason to believe it will be any different for RMAS. We're concerned that hundreds of disciplinary hearings will happen without our office ever being notified, that our clients will be forced to spend days in solitary under the guise that they supposedly refused legal representation. Therefore, we would like to be provided a video recording of any refusals that take place. Furthermore, we're concerned that there's going to be a significant lag time between when a client is placed in pre-hearing detention and the disciplinary hearing, forcing clients to serve the maximum sentence for whatever they're being accused of before the hearing has even begun. We know this is a possibility given how long it can take for the department to provide video footage after it has been requested. And when this inevitably happens to our clients, we're hoping they can receive some kind of restitution. And lastly, we're concerned that the department will, as they mentioned they would do earlier this morning, continue to weaponize executive orders in order to evade the law and continue to avoid the implementation of RMAS as they've been doing for months. Essentially, the department acknowledged that they would begin RMAS, but use executive orders to actually not do RMAS. And we're calling on the board to do everything in your power to ensure that RMAS is actually implemented. And I hope that you will take our questions and concerns into consideration and hold the department accountable to providing answers. Thank you for your time.
Thank you very much. The next individual on our list is Sarita Daftery.
Good morning. Are you able to hear me?
Yes.
Okay, thank you. I first want to start by thanking the board for what felt like one of the most informational meetings in a long time. Your visits, your clear documenting or sort of verbally going through the emergency executive orders and playing a voicemail from a person in custody was incredibly important, and I encourage you to continue that. People on the inside need it. Certainly every one of our members who has a loved one inside right now is fearful for their life every day, and it is incredibly important for you to continue doing what you're doing. I want to comment just quickly about the Commissioner's response around OBCC and EMTC and the suggestion that there's not enough staff, and continually name that as false. The commissioner said that it's a problem when you don't hire for attrition. It's a problem when your staff don't come to work. This is a department that has 7,000 uniformed officers for 5,500 people in custody. They have made it too easy for people to not come to work, and people have taken advantage of that. They have 7 times more officers per person in custody than the average jail system in the country, and they have 2 times more officers per person in custody than they did themselves 10 years ago. This is not a problem of staff. And in particular, I want to urge the board now that given your visits to Rikers and more frequent visits to Rikers to really think about guiding the department through a process of consolidating operations and closing jails, because they are not doing it on their own. It's important to note that the department currently has 9 jails open. To close Rikers, you have to start closing jails. And they have 9 jails open with combined capacity of about 11,800 beds. So it is just not true that they are lacking in space in any way or overcrowded. They could consolidate operations among the jails that they have. I think that the board would have a unique insight into the ways that they can do this to the benefit of people in custody, and particularly reducing unstaffed posts. It's in the May budget hearing, they reported that they currently have about 1,000 staff assigned to GRVC, where there were at that time 500 people in custody. Why would they not move? If that's where you have staff assigned, then shift some staff to that jail. Shift some people in custody to that jail, move over whatever staff are keeping an operation open at OBCC, and reduce unstaffed posts. So one of the disadvantage I think that advocates are often at is that we do not have insight into the day-to-day operation of the jails, but the board can. And it's an incredibly important moment to be thinking about how every creative way to improve delivery of services. And we have every reason to think that consolidating operations would do that. So thank you again.
Thank you. Next, I'm going to call on Diana Griffith.
Good morning. Can you hear me?
Yes.
Okay. My name is Diana Griffith. I'm a legal advocate at the Prisoners' Rights Project at the Bronx Defenders. Today, I will be sharing the stories and experiences of our incarcerated clients who continue to languish in the facilities so grossly mismanaged by DOC and CHS. The complete lack of transparency and the pervasive culture of dysfunction inside these agencies endanger the lives of our most vulnerable incarcerated clients daily. In particular, it is extremely concerning that Correctional Health Services continues to refuse to effectively communicate with the defense legal team regarding the status of incarcerated people diagnosed with a serious mental illness. Often we do not learn critical information and updates about our clients' mental health status unless clients are able to directly communicate with us and let us know what is happening. We are asking that there be ongoing oversight to ensure CHS complies with Local Law 190, which was passed back in October of 2019 to address precisely these issues and improve communication between CHS and the defense legal team. When we do receive letters based on Local Law 190, they are inaccurate or missing vital pieces of information. These are some quotes and comments from Bronx Defenders staff social workers about this issue. One social worker said, "My client has been on suicide watch since his admission, and this letter makes no mention of that." Another quote was, "Since the last letter, my client has been moved to a MO unit, and this letter doesn't mention that at all." We have also heard from the experiences of multiple clients who are actively battling suicidal ideation, often after they have already attempted suicide multiple times, who continue to be arbitrarily taken off suicide watch and placed in general population. Over the past month, the cries for help have increased tenfold, many of them with no history of suicidal ideation or mental illnesses. But the state of despair and hopelessness is too much to bear. A client whose permission we have to share his story, whose name we won't be disclosing, was denied medical care after engaging in self-harm. He told us that the CO on duty told him, "If you're going to cut yourself, I am going to teach you a lesson." The following morning, a different CO saw that his cell was covered in blood and sent him to medical. Unfortunately, it was too late to give him stitches because the wounds had begun to scab over. And lastly, regarding the implementation of RMAS, we are again requesting that we as offender organizations be permitted to tour the space. We need to see what the setup of the space looks like. We shouldn't have to take DOC's word that they're compliant with Halt, that they have enough staff, that there is going to be enough privacy for legal visits, among many other issues. It has been proven time and again that DOC is a dysfunctional institution that willfully fails to uphold compliance with some of the most basic standards. Thank you.
Thank you very much. The next person on our list is Chaplain Dr. Victoria A. Phillips.
Hello? Wait, where am I? Hello, can you see me? Can you hear me?
I can hear you, and I can't see you, but now I can see you.
Oh, okay, so everything's working good? Okay, perfect. Peace and blessings, everyone. Once again, Chaplain V. And first, let me just say I'm happy to finally hear BOC play the voices of New York City community members on the record. You know, I started that years ago trying to get the voices played on the record, so I appreciate your effort today. But you still need to give them a working number to call in directly in real time to these meetings. So I'll continue. At a time where, regardless of change in leadership, has continuously failed to create the change that ensures every life detained will have the human right and basic conditions afforded to them to remain alive at all times. This oversight board of correction budget should at bare minimum be 1% of the very agency you oversee. I wanted to make sure that was on the record. The New York City Department of Correction population is already 50% to have some form of mental health concern. 86% of the women held also fall into this category. And we know of at least 3 individuals that this great city failed this year alone based on the death report of this board. That is the oversight progress we need more of. We are a city that continues to harm its most vulnerable populations of color, the very systems built and designed to this current day off of white supremacy. They actually destroy our community members from within in solitary confinement. When will this city realize that B and C numbers, booking and case numbers, are indeed heartbeats? The commissioner spoke today of earning a trust of the people. So I ask, how can the people of New York City trust any law enforcement agency with the historic documented abuses such as NYPD and even DOC? And I mention NYPD because the Marshall Project recently reported nearly 40% of police agencies in the U.S. did not successfully submit any data in 2021 to FBI's revised crime statistic collection program. And New York City was a part of that. So again, I want to ask on the record, who is this city of New York incarcerating and why are we not utilizing diversion when most cases would make that possible? How ironic in 2022, the city of New York has a black or brown mayor, police commissioner, DOC commissioner, speaker of city council, and even here at the Board of Correction. Yet we cannot guarantee anyone's medical or physical care while in the control of New York City Department of Corrections. We must stop allowing the political pimping and funneling of our most vulnerable community members simply to build revenue for the city and state. In 2022 and beyond, I ask that balance become the key to this board. Your actions should not solely lie with your political cliques or parties, but for the needs of the people of New York City, and that includes all heartbeats, whether you personally deem them worthy or not. So please continue to show up at the jails and do what you are supposed to do. And very quickly, I want to say, as co-chair for the Young Adult Task Force, I believe that DOC needs to have more communication with us advocates, because you cannot say you're moving forward, or you can say whatever you want as the commissioner and leadership in DOC, but it's not healthy to say you are moving forward or making plans about something and not even discussing things with the co-chair. I am very disheartened and heartbroken today to not have even been invited to graduation with the young adults. I have showed up every year, even with my brain surgery, to support the young adults for their graduation. And that is just an example of the lack of communication with DOC and even someone like me as co-chair. Peace and blessings, everyone.
Thank you. Kayla Simpson is next on the list.
Hi, can you hear me?
Yes.
Oh, wonderful. Good morning. I'm Kayla Simpson. I'm a staff attorney at the Legal Aid Society's Prisoners' Rights Project. And first, just want to welcome new board staff and also sincerely thank the board, as Sarita did, for providing the information about the board's observations from within the city jail and exploring the emergency executive order is so valuable. And I now don't need to describe to you the unacceptable conditions in the jails because you relayed them. Daily suffering of human beings. And that's what our clients are telling us every day. More than ever, an independent, vigilant board fulfilling its duty to tell the truth about what's happening in those buildings matters. It matters because what we're dealing with is a status quo of dysfunction and violence that has been enabled by bureaucracy and hides behind bureaucratic language, plans, initiatives, reviews of policies, new units with new names. But are the jails safe? No. And when you have an administration here today championing plans, but presenting misleading data, A decrease in uses of force and stabbings and slashings, but compared to when? Historically and shockingly high numbers? A return to staff that still puts us at out sick numbers of 1,000 staff a day, which isn't even back to 2020 levels of sick leave abuse? When they filed a plan in Friday in Nunez that says they need 60 days to figure out which members of their workforce are even available to work? When they can't answer your basic and reasonable questions in this meeting about who's working in their facilities? When their response to a truly horrifying EMTC intake update that, by the way, also indicates an ongoing violation of a federal court order in Nunez, is vague staffing initiatives and blame for budgets and other administrations? This lack of basic managerial competence is not normal. This is not acceptable in other correctional systems. And hearing these skewed responses from DOC today should raise alarm bells for all of us. The board's unique charter commissioned access is more critical than ever. And we need regular published reports from the board about the observations of board staff. They are a wealth of detail and the public needs it. And turning briefly to RMAS, I know it's short time. The presentation from DOC today was outrageous. Again, the department offers an update on RMAS that is so vague it is devoid of meaning at the same time as they are talking about earning the public's trust. We now know exactly one thing for sure. DO said they couldn't do something yesterday, and then today, after backlash, suddenly they can. They have not, to date, been able to answer our fundamental questions about items like discovery, how we'll have meaningful time to prepare with our clients. This is now 2 weeks away. Every corner of RMAS requires careful, diligent preparation if it isn't just to become yet another abusive isolation scheme. How can they possibly be ready on July 1st? And once again, the people who will pay for this mismanagement are people in custody. And you need look no further than the ESH update today. The department confidently told you we are in compliance with Halt. We have been for months. But the truth is that they can't even comply with either state law or ESH policies on something as basic as letting people out of their cells. The board's obligation in this moment is clear. Serious interrogation on the details of those implementation efforts, focused monitoring of ESH, True, Secure, NIC, and whatever units they're using for RMAS. And I mean conditions, time out of cell, propriety of placements, length of stay, availability of medical care, food, rec, basic services, and then please, we urge you, issue reports. Thank you so much. I appreciate the time.
Thank you. Ashaki Antoine.
Bobby, do you have your hand raised on purpose? Did you want to speak?
I'm here.
Is Ashaki? Oh, good morning.
I am.
Hi.
Good morning, board. How are you? Good morning, everyone that's on this public call this morning. My name is Asaki Antoine, and I am the first citywide trustee of the Correctional Officers Benevolent Association. Since the last public meeting in May, unfortunately, 4 females assigned to Rikers Island were sexually assaulted. Officer A was slapped on her buttocks as she performed her assigned duties for the day. Officer B, breast was grabbed as she prevented the inmate from entering a housing area unauthorized. Officer C, while on a properly manned post, was subject to an inmate exposing his penis, masturbating, which resulted in the inmate's semen making contact onto the officer's uniform. And one civilian, a clinician, breast was grabbed also as the inmate attempted to enter her office unauthorized. 28 females have been sexually assaulted, and countless others are sexually harassed daily. The public apologies given by all stakeholders without meaningful action has become painfully frustrating. What's also a bit frustrating is that last month's meeting, the BOC made several public recommendations for the Department of Corrections to revise 2 specific operation orders. To the board, where are your recommendations forwarded to the department holding inmates accountable in real time when they sexually assault and physically assault correction officers, nonviolent inmates, and civilians? Yes, the inmates are rearrested. However, as I have said repeatedly, these predators are moved from one housing area to another, and most times they continue their violent behavior. So now I pose this question to you, the BOC. Have you considered any recommendations regarding the inoperable and broken cell doors throughout the facilities on Rikers Island? Every correction officer assigned to the B post, while making their tours continuously, should be able to perform their duties without the inmates exiting their cells without authorization. In addition, every detainee is required to have their cell door secured, especially during lock-in and lockout times, without having anyone manipulating it to gain access to commit crimes. It is also public knowledge that the cells do not work, but yet correction officers are disciplined for not securing something that simply cannot lock or can be easily manipulated. Last month, during the public comment period of the meeting, I gave a recommendation regarding fixing the cell doors. Was the recommendation taken into consideration? I don't think so. Security risk groups housed together are still overpopulated in AMKC, OVCC, and NIC, creating a hostile work environment for the officers, an unsafe environment for non-violent inmates who are not gang affiliated. As per DOC policy, inmates classified as maximum security inmates are to be housed in a cell. As of recent, max inmates who are most violent, murderers, rapists, in custody are housed in dormitories. BOC, I need you to look into that practice. Inmates continue to threaten correction officers and display weapons, shanks, which are captured on Gentech video. Every detainee housed on Rikers Island has a weapon on their person or internally secreted. Are you all watching the Gentech videos? Do you think it's acceptable for correction officers to work under these conditions? Would it be acceptable for your child or children to work under these conditions? In closing, we have lost 500 officers from January to this year to present due to resignations, retirements, and terminations. The reckless and irresponsible actions of some of the city's councilmen and women by not supporting the need for 578 officers in the fiscal year budget shows that safety and security of the jails, and most importantly, for correction officers, inmates, and civilians is not a priority. Responding responsibly to the crisis on Rikers Island means to address every issue brought to you, regardless of your political views, with urgency and with emotional intelligence. Thank you for your time.
Thank you. The next person on our list is Zachary Katz-Nelson.
Hi, everyone. Good morning. I'm Zachary Katz-Nelson. I'm the Executive Director of the Littman Commission. Thanks for the chance to speak to you all today. I want to touch on a few things. First of all, the reports about EMTC are terrible to you. They're shocking, frankly. It sounds very similar to the conditions that we had at EMTC in August and September last year. And if that is the case, or even close to it, alarm bells should be ringing. I mean, I really appreciate Dr. Cohen, what you were saying about the concerns that everyone should have about sending people there, or keeping people in those conditions. It seems like this should be as widely known as absolutely possible. It really kind of leads to a broader point, which is that the board has been playing, it seems, a really active role. I agree with everybody else that's spoken before on this, in doing the site visits and really calling attention to issues inside the DOC. And it sounds like the commissioner has been very responsive, both to Ms. Pitts when she talked about NIC, when you've talked about other conditions at ESH. But, you know, first of all, it points to a few issues. One is that the public at large should know about these things between the board hearings. Certainly city council members, state legislators who are interested in these issues, please report to them, tell them what you're seeing as well, fill them in, because they have oversight responsibility as well. I think it takes a team effort here to get everybody engaged and involved, and they will do their own site visits as well to bolster yours and your staffs. That's one. Two, these issues that, for instance, what Ms. Pitts raised at NIC, why wasn't that already known to the commissioner? What is happening inside the department about the failure to raise issues to the heights in the department they can get things done, get things changed? And if he did know about it, it doesn't sound like he did. I'm sure he would take action if he could. And so we have to have better systems in place, have to dig into why these issues are not being raised so that action can be taken. It shouldn't be up to the board to raise them. But while DOC is not functioning properly, it is essential that BOC staff, that you as board members, please continue those visits and please publicize widely, both as you have today, but also between the meetings. Tell reporters, tell other legislators, tell folks who can actually impact this day in and day out, in addition to the commissioner, so we can keep moving things forward. And again, those conditions at EMTC sound egregious, sound absolutely unsafe, sound dire, and have to be addressed immediately. The answers that we heard today sounded insufficient to me. I hope that everyone continues to pay serious attention to what's happening there. Again, it harkens back to times before people living in feces and urine-filled cells, packed to the gills like they were in last summer. That's absolutely unacceptable. No matter what someone may be charged with, they cannot be put through that. And so I ask that everyone please continue your work. Thank you for everything you're doing. Let's keep the pressure up together. We can make a difference, but you are. But please keep moving forward. Thanks so much.
Thank you. Francis Gatellis. Is Francis Gatellis here?
I'm seeing that Francis has left.
Okay, thank you. Next on our list is Tanya Krupat.
Can you hear me?
Yes.
Okay, thank you. Good morning. My name is Tanya Krupat. I'm the director of the Osborne Center for Justice Across Generations and a member of the DOC Visiting Working Group. Thank you to Amanda Masters for mentioning visiting at the beginning of this meeting, and to BOC staff we have met with recently about visiting. Visiting is remarkably absent from these meetings and the department's reports, and I hope that can change. While the most powerful voices to hear from would be children, families, and visitors, these meetings, like the current in-person visiting hours, are difficult to impossible for families to make. Osborne and Our Children provide a visiting and video visiting program for women at Rose M. Singer Center. I would like to relay feedback and recommendations from some staff of this program, as well as discuss the priority items of the DOC Visiting Working Group, of which I am a member, along with representatives from the Jails Action Coalition, Brooklyn Defenders, Our Children, the Fortune Society, and CASES. I would like to remind the board and department that prior to COVID, Rikers received about 700 visitors per day. Pre-COVID, about 14,000 visits happened each month, treasured moments that kept many people connected and gave them hope. Then visiting was completely shut down for close to 16 months, a period that normally would have included about 224,000 visits. No visits happened at all. We really need to pause to appreciate the monumentality of this and the trauma that has been endured during these past years for those incarcerated who are completely isolated, cut off from their children and families, and for their families who fear for their survival every day and every night. Many people who lived through this isolating, scary time are still on Rikers. DOC finally resumed reduced in-person visiting on June 9th, 2021. It's now been a full year since then, and there are still no weekend in-person visiting times. The hours during the week on Wednesday, Thursday, and Friday are pretty impossible for school-age children or working people to make. One mother has been hoping her 3 children, ages 5, 11, and 13, could come visit her for the last 9 months, but they live and go to school on Staten Island and can't make it during the week. The Friday time is 8 a.m. to 2 p.m. when they're all in school. Televisiting is offered only on the weekends from 8 a.m. to 2 p.m., which poses challenges as well, especially for foster care caseworkers who don't work on weekends. In registering for the weekend video visits, there also seem to be only 3 one-hour slots per day, although the website average says there will be 6. It's great that the department pivoted quickly during COVID to offer video visiting, and the response has been very positive, facilitating connection between those incarcerated and their loved ones who are unable to physically visit or are in other states. While video visiting can be great, it's no replacement for in-person. In-person visiting should be reopened on the weekend, and there should be video visiting days during the week. I just want to raise a few additional challenges that deserve attention and should be addressed. Despite the pre-registration system, many visitors report that the wait times have gotten longer, not shorter. The route buses to take visitors off the island often are run infrequently, and visitors wait for up to an hour or more. Visit officers are not always given the quarantine list and don't know which houses are affected. The uncovered posts and staffing deployment also affect visiting, especially if there's no officer to escort an individual to their in-person or their video visit. When this is the case for an in-person visit, it can be devastating to both the incarcerated individual and their visitors. This can lead to feelings of anger and frustration, which are not helpful to have on a housing unit. There are also technological and logistical challenges with video visiting. Sometimes people are alerted to their time after their slot has already passed. And on this note, we would like to see DOC designate a high-level person within the department whose responsibilities include visiting. This would include monitoring data and practices, tracking issues like understaffing, a lack of steady visit officers or captains, overseeing the quality of visiting rooms, and more. In closing, while visiting is not a panacea for the serious and concerning issues of unstaffed posts, conditions at EMTC, and increasing violence, it is important that the department and the board include visiting among your priorities, recognizing visiting not only as a minimum standard to uphold, but as critical to the well-being of those incarcerated and to reducing violence, which promotes the well-being of officers and DOC staff as well. Many providers and the DOC Visit Work Group members stand ready to assist however we can. Thank you.
Thank you very much. The next person on our list, and I believe the final person on our list of our public comment list for today is Kelly Grace Price.
Hi, good afternoon. Good afternoon. It's Kelly Grace Price.
Good afternoon.
I'll turn in my written testimony. I was shocked at what I didn't hear from you today, Commissioner Molina. I'm just going to start with that. We've heard you time and time again in city council hearings, in BOC hearings, promise data. Thank you, Freya, for drilling down and letting us know that we don't have any kind of in-Bobby facility level data. That's really shocking. It's heartbreaking to hear that we don't have any idea what's going on with programs. We've also heard again and again that that information will be provided. I'm so tired of waiting. We have no idea what will happen with reporting, with RMAS. I've turned in extensive written testimony asking for the reporting aspects of the rule to be flushed out and made public. Still, nothing of that written into the rule were deadlines that have long since passed for those data metrics to become clear. I have no hope. I don't want to express, mean outrage and say nasty things, but I just don't have any hope at this point. And it's shocking to hear that DOC was even considering not implementing RMAS. It's not DOC's decision, as we all know. So maybe, Amanda, I'm so proud to see the people that you've hired at the BOC and to see the things that you've already managed to implement in your short time here. Maybe you can start thinking about other ways to get out of the DOC what you need. Maybe you have to consider litigation to get the data that you need. I don't know, but something has to change. And we can't know what we don't know. And as Bobby said, the entire basis for the EEOs is the staffing shortage that we really have no data about. So we have no idea when we can expect that staffing shortage to end. We cannot keep operating in this abyss. I'm really hoping for federal takeover at this point. I'm just going to actively keep saying that. I have no hope in DOC coming um, to any kind of fruitful conclusion. It's so depressing to put all of my work and energy into following these meetings. And it's so depressing to hear nothing from board members. Dr. Safer, where are you? Sometimes you say really great things. You're a doctor. You've been on this board second longest of all the members, Bobby, the longest. Please, let's hear from you. Um, uh, I just have the other board members that have said nothing. I'm sorry you're not feeling well, but we really need your leadership. I'm really hoping that we can see it from you. I'll turn in my written testimony. I'm tired of hearing myself whine about these things. Commissioner Molina, shame on you. Thank you, Kelly Grace Price. Close Rosie's.
Thank you. And that concludes the public comment for today, and it also concludes our agenda for today. And so we will adjourn our meeting today. And I will, in closing, remind you that the board's next public meeting is scheduled for July 12th at 9 a.m. We will provide meeting details on our website and send an email to interested parties. Just a final note, whether the meeting will be fully remote or hybrid depends on the state of the open meetings law on that date. Absent any objection, I will now adjourn the meeting. Meeting adjourned.